We had some technical difficulties in getting things started, but we are good to go at this point. So without further ado, I'll turn things over to our board president, Mrs. Gray.
Good evening, everyone. This is a call to order for this special meeting of the Board of Education. We're going to begin with a salute to the flag. Mrs. Beckman? Does anyone see Mrs. Beckman?
I'm here. She's there.
Oh, Mrs. Beckman is kind enough to provide the flag for us for these meetings. So if you can see her, she has a flag. So we'll begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mrs. Beckman. Mr. Syed, could we have a roll call, please?
Sure. Ms. Beckman?
Here.
Ms. Schaefer?
Here.
Mrs. Gray?
Here.
Mr. Salmon?
Here.
Mrs. White?
Here.
Mrs. McEwen?
Here.
Mrs. Richmond?
Here.
Mrs. Korn?
Here.
Mrs. Woolridge?
Here.
Mr. Markarian?
Here.
Ms. Fox?
Here.
Madam President?
Thank you, Mr. Syed. And welcome, everyone. Thank you for your patience as we worked out some technical issues. And thank you very much to our tireless and trusty Director of Technology, Mr. Alex, why am I drawing a blank? I apologize. Blinder, thank you. And welcome to this special meeting of the Board of Education of Bernards Township. Notice of the time and the place of the meeting was provided, and copies of the resolution were forwarded to the official newspapers as designated by the Board of Education and the Township Clerk. A copy of the notice was posted on the bulletin board at the Board of Education office and in accordance with the Open Public Meetings Act. Due to the public health emergency, the state of New Jersey has declared in Executive Order 103, the board is suspending normal meeting procedures this evening and conducting this virtual meeting. The directions were on the website. Many of you are there already. We very much welcome your input from the public. Please, because this is a virtual meeting, public comment will be handled as follows. Please email to BT, like Bernards Township Connect, at bernardsboe.com or text to 908-292-3047. Use public comment as the email subject or the start of your text message. Indicate your first and your last name and your address. This information is required for your public comment to be included in the record of this meeting. Please keep your comments to a maximum of approximately 3 minutes if they are read aloud. No public comment will be accepted after item 12, board forum of the agenda begins. And with that, we'll go to Mr. Markarian and the superintendent's report.
Okay, well, again, thank you everyone for being here this evening. Again, apologies for the late start. Obviously, tonight we have a packed agenda. We want to basically cover 3 topics. We want to talk about the road back to school in the areas of our health for our students and staff and visitors. We want to talk also about survey results that we've given to our staff and also to our parents. And finally, we want to talk about the ideas that we've been considering so far in terms of schedules for getting back to school. I just wanted to take a moment to thank our panelists that are here tonight to help us talk about the health issues. We're graced with the presence of Lucy Forgione of the Health Department, Rita Zarabera, the District Nursing Coordinator, and we have 3 guest doctors, Dr. Kaufman, Dr. Spiesler and Dr. Salaki. I just wanted to let everyone know that obviously we do not have an infinite amount of time with our doctors and our panelists. We expect to go no later than 8:30, and I already know that one of our guests is limited to 7:30. So again, I apologize for that late start. Finally, I want to welcome our two new principals. This is the first board meeting that they are attending. Mr. Russell Lazovic is here, the new principal of Ridge High School. So congratulations to Russ. And also Holly Foley, the new principal of Oak Street School, is here with us for her first Board of Education meeting. So thank you all for being here tonight. With that said, I know that our nursing coordinator, Ms. Rita Zarabera, is going to preside over our panelists and our discussion tonight regarding the health issues associated with our return to school. Rita?
Thank you, Mr. Marcari. So I have a slide presentation that I'd like to bring up if I could. Can you share your screen?
Sure.
Good, okay. Let's go to, sorry. Okay, so hopefully you can all see that. This evening, we're going to discuss the New Jersey Department of Education's Road Back Plan for Education. In it, the Department of Education presents the anticipated minimum standards for districts to consider. We're also going to refer to CDC guidelines and the American Academy of Pediatric guidelines tonight. Our focus in this panel discussion is really on health and safety. I'd ask actually for everyone to take notes or hold your questions until the end so we can try to get through the presentation. Being that Dr. Coffin has to leave us, she has a prior commitment at 7:30, I thought I would just introduce her and then give her an opportunity to speak so she can let us know her thoughts. Dr. Susan Coffin is from the Division of Infectious Diseases at the Children's Hospital of Philadelphia, and she has expertise in both epidemiology and pediatrics. So Dr. Coffin, would you like to tell us a little bit about your thoughts?
Sure. Thank you for accommodating my schedule. I think the most important things for me to share with you is that the deliberative process that you're undergoing is essential. The times that we're in really do call for building consensus around how your community will have achieve the dual goals of getting kids back to school, which is essential, as well as maximizing the safety and health of the community. I think just like the community at large, though, schools are complex communities. They include people of all different ages and degrees of risk when it comes to the coronavirus, and they require some very complex decision-making about where the priorities will be in terms of the safety measures that have to be balanced against the instructional goals that you're striving to meet. Some of the things that I do think are really valuable to think about, and I wish I could spend more time hearing what your public health representatives will be saying, is I do think it's really important to unite your school plan with your public health, county public health efforts. I think that school is the place that we teach children our community values, and it's the place where we teach children how to be good citizens. And I think this is a great example of the importance of school in communicating to our children how we as a community keep each other safe. That said, I think the specifics of a return to school plan are going to need to be flexible. There's definitely not going to be a one-size-fits-all across the various schools, even within New Jersey, definitely not across the US. And it's going to need to be flexible over time. I think we're likely to see ebbs and flows of viral activity over the course of this upcoming school year. And I recommend all schools be prepared for that and anticipate that they will need to have a plan B and maybe even a plan C to turn to if viral activity increases or if viral activity decreases. And so these next 6 weeks, I think, are especially precious for people responsible for planning for school reopening. I think the specifics of what are components of a back to school plan are so individual. They're based on the school's resources, the combination of the numbers and nature of the students served, the teachers and other staff in the schools, and what will be the viral activity at the time school reopens, that I hesitate to be too prescriptive and say a good school plan needs to include A, B, or C. And so what I'd rather do is just stop there and let others join the conversation.
Okay, thank you. Thank you very much. So I guess I'd like to introduce the some of the other panel that's here tonight. Let me see if I can get one. So can you all see that okay? No, it did not advance. There we go. Okay. So Dr. Matthew Spiesler is a pediatrician, and he is our Bernards Township district physician. Besides that, Dr. Spiesler has also been a Board of Ed member himself, and he serves 5 school districts in New Jersey as the district physician. Lucy Forgione is our Bernards Township health officer, and Dr. John Salaki is an infectious disease physician and also president of the Bernards Township Board of Health. Our goal tonight is to provide some insight and recommendations for reopening schools and for safely, and also for our school community. So when we talk about a school community, obviously our focus is on students and their education, but the community is made up of many other people. We have adults that comprise the district here. We have 800 staff members and 5,000 students. Teachers, counselors, aides, administrative assistants, administrators, nurses, cafeteria workers, bus drivers, and custodial staff. So we obviously have to be cognizant of that and plan for everyone's safe return. The New Jersey Department of Education has outlined considerations for return to school, and I just want to go over them briefly. The first is that education health does not come at the expense of our public health. The reopening of our schools will include necessary limitations to protect the health and safety of our students and staff. And conditions for learning must not only address the students and educators' basic physical safety needs, but also the social and emotional and environmental factors that will impact the educator's capacity to teach and the student's capacity to learn. So I'd like to start tonight with the discussion with Ms. Forgione from the Health Department and ask if you could talk to us briefly about the virus in our community. What have you seen? Where are we today? And if you can give us any information or insight on that, we'd appreciate it.
Well, thank you for having me this evening. My office and my staff has been working diligently for the last 5 months. We find this to be a great opportunity for us to collaborate early and often with the school administrators and school nurses. And we want to make joint decisions based on school reentry planning decisions. As it looks in our community and nationwide, in our nation, we've had over 3 million cases of the COVID-19 and over 130,000 deaths. Somerset County, 439 cases and 458 cases. Bernards Township, presently we have 308 cases, of which 6 deaths. The majority of our cases are within the 60-year-old age group. And a good portion of our cases are in our long-term care facilities. Most recently, I've seen a spike in cases. I do believe it has a lot to do with the warm weather and people going out. I also saw the Memorial Day weekend, and also I suspect with the 4th of July weekend, we will be seeing more cases. But I must say that our Bernards Township residents have been very cooperative. And I've had cases that have been very few for the last few months, and now we are seeing a change in those. We monitor everything very, very carefully every day. We're reviewing a system that we have in place called the Communicable Disease Registry and Surveillance System, in which all lab results go into this system. And then one by one, we are able to look at the cases and do case tracing, meaning whoever is positive, we will see who that individual has been in contact with and follow up appropriately.
Thank you, Ms. Forgione. Mr. Markarian, do you want to advance the slide? Sure. Thank you. So I thought we would start with a brief conversation about the virus and how it spreads. And I'd like to ask maybe, I think, Dr. Coffin, are you still with us? I'm sorry, or did she leave? No, I guess she left. Okay. So maybe to Dr. Salaki, maybe you can speak to transmission, and what is the most likely way that COVID-19 will spread in the schools? When we were back in March, what we were hearing at that time was that the virus was basically droplets, and it was heavy droplets that would drop to the ground. It would fall on surfaces, and we were concerned with a lot of the surfaces that people touched a lot. And now we're hearing some more about aerosolization, small particles that remain in the air. So could you speak to us a little bit about what we know now and what the concerns should be inside of schools?
Hang on a second, Rita.
Yeah.
Let's check and make sure he's unmuted.
Okay, there we go.
There we go.
Okay, can you hear me?
Yes,
Yes,
we
sir.
can.
Okay. Thank you very much for inviting me to join your panel and to be here tonight. I think it's a very important topic, one in which myself, having spent my career in infectious diseases, often read about, but probably was never thinking that I'd actually be in the midst of it. To your point, and to the point that we've been experiencing over the last several months, this is the first time I think our country and society as a whole has experienced a new infectious disease that obviously is extremely contagious in the sense that it attacks many people at different ages in different ways. Because of that, it's been a progress in learning, I think, for all of us. As you mentioned just now, in the beginning, there was a lot of concerns expressed about the type of spread of this virus. Let me just start off by simply saying one thing that has not changed is that this is virtually a respiratory virus, which is spread by anything that is produced by us as a droplet that we can cough, spread, or sneeze in different ways to other individuals. And I think remains that the cornerstone of the problem of the contagion side of this whole process and its infection. In the beginning, as was mentioned, we were concerned about hard surfaces where droplets would form and fall and how the virus would be on those surfaces. That still is a concern, but not to the degree that we originally thought, only in the sense that the longevity of this virus is seemingly shorter lived to the point where we have to be careful about fresh droplets that do fall on surfaces, whether they be metal, whether they be wood, whether they be other devices, cardboards, etc., but not to the extent, I think, that we thought in the beginning. And one of the reasons for that is we have tried to evolve into a situation where we minimize, as a society, the spread of these droplets from one person to the other by various means, and the main one being, of course, wearing some type of protective device to prevent that spread from one person to another and for those droplets to be a contagion on other objects. So the person-to-person contact, the aerosolization, the process of the spread of this virus really has remained the same, and in fact becomes more important, I think, over the last couple of months as we learn more about the ability of this virus to spread. It is very similar to an influenza virus in many ways, but in my own personal experience and those of colleagues in my field, the degree of ease with which the virus can spread from one person to another seems to be of a higher level than maybe some of the viruses, such as influenza, that we've experienced in the past. Part of this is due to the fact that it is a new virus, and we have no one really in society before this virus approached us in society where we had people protected by immunity from prior exposures, because this is a new entity. So I think going forward, and without spending a lot of time right now, I would say that a cornerstone of whatever we're going to be doing for getting society back and integrated to some sense of a new normal is going to have to center around the ability to control our own abilities to avoid spreading the virus to others and to keep it confined as best we can by caring about not being in close contact as we have been in the past with close groups, et cetera.
Thank you. And can I just ask a little bit about asymptomatic spread and what the risks are there, especially with children? Obviously, we're in large school buildings with a great number of children, and we hear a lot about asymptomatic spread.
Right. Asymptomatic spread, I think, is an extremely important product, okay, that we are learning as time has gone on with testing that is occurring. I mean, you have not a large, but a very noticeable percentage of people that may be asymptomatic and have the virus without symptoms. In the beginning, as you recall, back in the early days of the pandemic, back in March and April, we were focusing on people getting tested who had symptoms. What we since have found out with further testing beyond the symptomatic group is that in doing general testing, we are finding that there's several percent of individuals that are asymptomatic. And this is a major concern, I think, going forward, because these same individuals that are carrying this virus and have no symptoms have the same potential for spreading that virus. They may never get sick because they have a lower level, perhaps, of virus association, but many of them will have maybe mild symptoms at worst in some cases, but many will go on, as you see across the country now, to the point where they get seriously ill as well. The point is that asymptomatic carriers are silent carriers, and those are the ones that feel well, have no symptoms, may be able, therefore, to spread this virus more easily because they are letting, if you want to call it, their guard down, and the guard down towards protecting others by not allowing themselves to spread this virus by the droplet mechanisms that we talked about. Children is a good point. There was items recently this week because of the increased news coverage of getting children back to school. We really don't have a lot of data on children, I think, enough that would give us an indication of what the carriage rate may be in children, whether there are higher rates of asymptomatic carriers in children. This is still something that needs to be worked out. But I don't think we should assume that young children, because they haven't been a big part of the illness population, are immune in some way from getting this disease or getting this virus and therefore spreading it to others. And I think that's something we have to keep in mind going forward.
Okay, thank you. Next slide, please. So the next topic I wanted to talk about was mitigation. And I think there are some recommendations from the CDC and their principles that are all familiar to all of us now. We hear about them every day on the news. It's all over TV. But I'd like to drill down on some of them and talk some specifics about what really is pertinent for schools. So if we can have the next slide, and we will start the conversation and talk about physical distancing or social distancing. And I guess the large question there is, how far is far enough away? So the New Jersey Department of Education, in their back to school road back, says that schools must allow for social distancing. Students must sit 6 feet apart, and if schools are not able to maintain physical distancing, then additional modifications should be in place. The American Academy of Pediatrics says that evidence suggests that spacing as close as 3 feet may approach the benefits of 6 feet of space, particularly if students are wearing face coverings and are asymptomatic. So the question that I guess I'd like to ask Dr. Spiesler, if you could jump in as our district physician, is how far is far enough? And do we need to plan for 6 feet apart when we're thinking about classrooms, desks, cafeteria, all of those things? Can you speak a little bit about physical distancing in schools?
Can you hear me?
Dr. Spiesler,
Yeah, can you hear me?
We can now, sure.
Okay. All right, I had to unmute this thing. Thank you so much for including me in this panel, because this is a extremely important topic that really the stakeholders really need to be involved in, and everybody else needs to be involved in. I think when the American Academy of Pediatrics came up with their 3 feet distancing, I think it was more important that that it was realized that if they were at that 3 foot distance, they would be wearing some kind of mask, face coverings, barriers, or something to make up for that 3 feet. If we look at how this virus spreads, and we talked about aerosolization and how it spreads, and we're seeing it now that we've opened up the shore and opened up businesses, that there's a spike in the number of cases. We really think that 6 feet is really more important. So if a student is in class and we're setting up classrooms, I think we need to have a distance of about 36 square feet between students. In other words, 6 by 6 space where the students would be physically distanced. I go back to what Dr. Frieden, who was the former CDC director, said. There's 3 W's: wear a mask, watch your distance, and wash your hands. Those are the 3 things that I think are critical in this particular situation. But I think if we're really talking about setting up schools and distancing, I think we really need to observe that 6 foot mark, because that's really what was determined based on some of the research that we've seen, how this thing aerosolizes and how the thing is spread. 3 feet is certainly okay if students are going to wear masks and we're going to cut down on the amount of spread, but this thing is certainly aerosolized. We know now that it enters through the nose. The nasal mucosa is extremely sensitive to this particular virus. This virus actually will go into the nose and break down the mucosa, and that's how it enters the respiratory tract and causes its disease. So the more we distance, I think the better off we are. So I think 6 feet is really what we should look at. The 3 foot distancing, I think, is something that if we have to, but we need to understand that with 3 foot distancing, there has to be other barriers in place to make up for that additional 3 feet.
Okay. And Ms. Forgione, I see you nodding your head. So are you in agreement with Dr. Spiesler there that the guide should be 6 feet?
Yes, and also I think some new research was recently discussed this week about the particulates being able to go as far as 9 feet. But that's all new research. We don't really know. I think the 6 feet, and also barriers. If we could develop barriers between students at their desks, I think that would be a very, very good thing to do as well.
Okay. And the other question I had was about cohorting. I don't know if Dr. Salaki, if you could speak to or maybe explain to everyone what cohorting means and how that can be applied in schools to benefit everyone that's there, and also regarding contact tracing.
Well, I think cohorting in general means, sort of putting groups together that may have some commonality in either their health issues, in this case, that we're talking about. And I think in probably in the context that you may be referring to is in schools, as far as mobilization of students versus keeping them perhaps in one location. I think there's been some evidence that suggests that obviously with the more activity and mobility, okay, that groups have within a closed space, that there's maybe a higher risk of perhaps virus dissemination among that group. Cohorting, keeping individuals in one location, I think is is one aspect that has to be considered, I think, when you come to talking about a virus such as this, that you can minimize maybe the contagion aspects of spreading because of the immobilization by keeping people safe where they're at with masks, et cetera. In those cases, though, you got another aspect they have to consider, and that's adequate ventilation. We're not talking about putting fans onto the students in the rooms, but to the contrary, you just have to have good ventilation for that purpose, okay, to move the air through an area where they may be confined. So that, you know, in infectious diseases, we talk about cohorting. When we have an outbreak of a particular infection, obviously, we put people that are infected into a certain area of the hospital to keep them away, just as the hospitals have done up in our area for the outbreaks, and they had units that were just for virus. The emergency rooms had separations, okay, and cohorting patients that were not or were infected with the virus, et cetera. I think that's a different aspect that maybe that we're not talking about as far as schools in this case.
Yeah, so, you know, it's really hard, obviously, especially in our middle school and high school where we have students that move from classroom to classroom and they mix, right, with students. They're not in the same class as maybe a second grade or third grade all day. And then obviously there's after school activities too to consider. So the Board of Ed and the administration has a huge task to look at, you know, how do you best do that and how can you cohort when you've got students really moving all over it and teachers and staff moving through the building all day long.
Yeah, I think that is an extremely important one. I think for the welfare of the children, obviously, there is advantages to being able to mobilize and move them around. But there is a downside that I think this virus has started to dictate in different circumstances, and schools now are going to be another one where we have to sort of make some compromises on, I think, what we're going to do as far as minimizing that activity. I don't think it's, you know, we talk about, you read articles about not allowing, let's say, free time in a courtyard, et cetera, for students to go out and do a leisure time, perhaps, just to break up the day. Although that's important, it can have its downsides as far as how do you maintain that social distancing, as was emphasized earlier, which I think is very important, and yet try to maintain the mental and physical health of the children.
And lastly on this topic, Dr. Salaki, can I ask you about some of the spaces in our buildings that are confined? So we have a number of offices, like I'm thinking about the counseling office, where there may be one counselor that meets with a student, but it's in a small space. There's probably no windows. So do you have recommendations or suggestions for what we can do regarding small confined spaces like an office?
Well, I think in any situation like an office, I think you're going to, first of all, have to minimize the number of people at any one time that are going to be there. I think Lucy alluded earlier in classrooms about plexiglass shields and things of this sort. We all know that they exist now in certain stores that we go to, certain businesses, et cetera, where we have people at cashier counters, et cetera. And I think having some type of a protective barrier on the part of the counselor, separating them from the individual, but can visibly see and hear the individual, I think is going to be very important to consider to protect both the student as well as the counselor themselves. I think wearing masks have to be maintained through that type of a conversation. Ventilation in the rooms, you know, I think is probably maybe not as much of a problem when you come to the offices as they may be set up, but I'm not an expert on the ventilation systems in buildings, so I can't comment on that. But I think the limiting the number of people in the office at one time, having the counselor and the student on a one-on-one with some protective barriers between them, I think is important to put together. And I think masking is something that probably would be important to maintain also.
Okay, thank you.
Cleaning, I didn't mention this, but I think in between visits, there's going to have to be some type of a cleaning mechanism, I think, for chairs and things of this sort that probably will go into that whole situation of preventing cross-contamination.
Right, that's a good point. Thank you. we're going to move to the next slide, and the next topic is face coverings, which is probably the hottest topic right now. Obviously, everyone in the nation, I think, is talking about face coverings. So I guess, Dr. Slack, I'm going to stay with you for a moment here and say that what we'd like to know is who needs to wear face coverings in school? Who needs to wear them? When do they need to wear them? We're hearing from, again, our two sources. The Department of Education is saying that school staff and visitors are required to wear face coverings, unless doing so would inhibit the individual's health or the individuals under 2 years of age. And students are strongly encouraged to wear face coverings. And then the American Academy of Pediatrics put out a statement saying that elementary students should wear face coverings if the risk of touching their mouth or nose is not greater than the benefit of reducing the spread of COVID-19. So I come back to, again, who should be wearing them?
Well, I think a lot of the people in the field of infectious disease and science today believe that face coverings have a significant value, and I think therefore everyone should be having a face covering. There's I think there's discussions about in classrooms should students in this case maintain face coverings in the classroom. I think that's not a terrible thing unless there's a contraindication, and there's a list of those, I think, that have been published as far as who and what type of health conditions would prevent that. If you have certain individuals with disabilities, I think they may be difficult to try to maintain mask coverings, but I think on average, the students should wear face coverings. And I think the teachers need to do that. I think we can't forget about the teachers, and I know we're not in these situations here. We are concerned, obviously, about the students and the interaction they have. But again, the teachers are in constant interaction with all a classroom of, in this case, it may be half the usual numbers of 15 or whatever in a class, but there's a risk there. So I think face coverings should be done. We know that data that's coming out, extrapolating data, and that can be argued by both sides as far as how many lives may be saved by by wearing face coverings to prevent spread. There's no doubt, and I think the data is there, as I said earlier, about droplets spread, and wearing face coverings will greatly minimize any droplet spread that we have. In young people, to your point, we have a face covering. It's obvious that a child is less likely to touch their nose or their mouth and things of this sort. That could be a source of contamination in certain situations. I think that's important too. So I think, wearing face coverings, in my opinion, is something that, unless there is a significant medical reason not to, should be done, and should be done in every situation. A child answering a question for a teacher, you may make an exception for understanding what the answer is or letting ease of discussion to have them remove it, but then to put it back on as we do in many situations now.
Okay. And Dr. Spiesler, would you like to jump in and give us your opinion on face coverings for the school?
Sure, thanks, Rita. Yeah, I definitely agree wholeheartedly with Dr. Salagi. The face coverings have shown over and over again that this certainly decreases the transmission of COVID-19. We know that this is a virus that's transmitted from person to person. As one CDC official says, it's really a wimpy virus. The most important thing is that it becomes aerosolized, and it goes in through the nose. And the way to prevent this thing is by having some kind of a barrier on the person's face. The concern that I really have is in the pediatric age group. As a general pediatrician, we don't know a lot about what happens with children. My concern is how this is going to be transmitted from the children, especially if they're not wearing face coverings, to the staff, the teachers, counselors, and patients people that are at high risk, especially if they're not wearing face coverings also. But I think there's a benefit, certainly the benefit of wearing a face covering far exceeds the disadvantage of not wearing one. And I think everybody should wear face covering. As one physician once told me in the beginning of this whole thing, he said, no face covering, no school. I don't know if we need to go that far, but I certainly think that we need to have face coverings not as an option, but as a mandatory situation. And again, as Dr. Salagi mentioned, in certain situations where they may not be appropriate based on what the child is, those cases we can continue, that should be considered and evaluated on an individual basis rather than a whole group. But I really feel strongly that face coverings should be mandatory in all of our staff and our students coming into the building.
Do you think there's ever a time that for maybe a student or staff member that has a pre-existing health condition that if they really couldn't wear a face covering, I mean, what do they do in that circumstance? Is virtual learning a better option, or is that something that we would just say, we ask them to consult with their own private physician about what the best thing is for them?
Well, I think the first thing is to firstly determine why this child can't wear a face covering and determine really what it is. People have suggested that using face shields and other methods are useful, but they're not really a substitute for masks and face coverings. And I think as we move forward, if we're going to have in-school learning for these children, which we may be mandated to do, we have to have other accommodations to create a physical barrier between the student and the people the educators that are teaching them, whether it be plexiglass, whether it be a shield plus plexiglass, or some other kind of physical barrier to prevent the spread of this virus.
Okay. And actually, if we advance to the next slide, we're going to continue and stay on this topic and talk about face shields and face masks. And maybe Dr. Salaki, could you speak to the difference? What's the difference between a face mask and a face shield? He's there. I don't see you anymore. I hope you're there with us.
I'm trying to figure out where I went.
We can hear you. We can hear you. That's fine. But a face mask obviously is something that covers the nose and the mouth. And a face shield, even from my experience in the clinical setting, was always something that you added when you were concerned about splatter, and it was protective for the wearer of the mask. But I think that when people see it, they see it's maybe a better option in that it's not so confining. But can you speak to the, whether or not that's something that could be worn in schools, or it doesn't really fulfill the objective that we want?
Sure. Let me start by making it clear. This has been a confusing issue, I think, since the pandemic started. We have two types of masks that we talk about, and the one that was heard a lot about was the N95 mask. N95 basically is a very fitted device. When we were at the hospital, every year we'd get fitted for this particular type of mask, and it's meant to be able to eliminate 95% or more of aerosolized type pathogens, from getting contact to the user of that mask. Those are the ones that are needed in hospitals when you're dealing with a highly contagious type situation, tuberculosis, contagious viral diseases such as this, and similar type things. And then we have the face masks that we are asked to wear as the average person outside the hospital setting, which is exampled in the slide that you have projected here, and other types of those. Some can be homemade, some not. These are meant really to prevent you as a wearer from spreading what you have out as a droplet to other people predominantly. It's not meant to necessarily filter out everything that you're breathing in. It's just the nature of the device, but the purpose of it is to prevent external spread from you to somebody else. So what the mask is doing is minimizing the droplet spread out of your system. And you do that, and you probably protect about 85% of what you spread normally in breathing, talking, coughing, etc. A shield, to your mention earlier, these are things that are more commonly used, let's say in a hospital setting. Emergency workers may use them because it's preventing splatter of any materials, whether it be blood, whether it be saliva, whether it be any other secretions, from reaching the surface of the face of that individual. But obviously the shield has openings all around it, which is not protecting any other droplets from getting there. So you'll see individuals that are working, let's say, with somebody with coronavirus, will have a mask and they will have a shield perhaps at the same time because of the nature of what they're doing. Certain specialists, like a pulmonologist who may be having to put a breathing tube down a patient, in a hospital setting has the risk of splatter and secretions, et cetera. So the shields are used for that purpose, but they're not meant typically for outside use. But as was mentioned earlier, you may have a child situation where masks are not a reasonable alternative. You may have to resort to a shield and other types of protective devices such as plexiglass and communicating, teaching, et cetera. That may have to be a secondary type modality for that type of individual, and that should be individualized itself.
Okay, thank you. Does anybody else want to weigh in on the shields? I don't know if Lucy or Dr. Spiesler or, no? Okay, then we'll move on to the next topic. So I'd like to turn the conversation to the issue of daily health assessments. The Department of Education has told school districts that we must adopt a policy for screening students and employees on arrival for symptoms and for history of exposure to COVID-19. And the American Academy of Pediatrics recommends taking the temperature of all children and staff at check-in every day. Whether or not they'll allow parents to record temperatures at home or staff to do self-assessments is kind of up for discussion. So obviously, if we were going to do that, performing health checks every day at school buildings would be a monumental task. So I'd like to ask maybe Dr. Spiesler, what you think about daily health assessments. Do you think this is something that we would have to do on site, or can we explore the option for doing home assessments, self-assessments?
Yeah, I think, certainly taking temperatures is an important aspect. We do it in the hospital. I do it in my office of all parents and children coming in. But I think, as you mentioned, this is really a monumental task. Mm-hmm. And to try to do this with a student body the size that we have would be very impractical. It's certainly a good thing to do. I'm not quite sure how valuable it really is in terms of assessing illness. I've talked to a number of hospital administrators since I'm affiliated with 3 hospitals and asked them what happens when they get an elevated temperature. And I kind of get shrug of the shoulders, and they're telling me, well, we advise their managers that they may be sick. I don't think this is going to be a practical thing for us to do in school. I think that parents should be encouraged to take their children's temperature as they should have done previously. We know that parents send their children to school sick. They give them Tylenol before they get to school, and then as soon as they get to school, the Tylenol wears off. They're at the nurse's office, and we have a sick child. I think more important right now is that parents know the importance of temperature elevation, that they have a method of taking temperature, and we should be encouraging parents to do this at home, at a home assessment versus doing it in school. I just don't think it's practical to do it in school.
Okay. Ms. Forgione, I'm going to ask for your insight here. Do you have an opinion on where we should do the assessments?
Well, it's all about responsibility and accountability. And I think it's really up to the school to decide how you can do this. If you can do it at 4 different entries into the school, that might be, if you're capable of doing that or feasible, then that's fine. Otherwise, I think perhaps make parents and children responsible and accountable at home. Certainly, staff can take their own temperatures before they leave their house, and they have to be accountable to the rest of the school body. But I think it's really up to the school and the number of students that you have on a daily basis, whether or not you can do this type of screening.
Yeah. The other thing, I guess, that, practically speaking, is a large number of our students travel on buses to school. So if they're on the bus and they're with other students, they get to school and then we're doing a temperature check or asking about symptoms, they've already been on the bus and been exposed to others. So doing a home self-assessment probably makes a lot of sense no matter what we decide to do as a school. But I think it's really important for parents to know that they need to keep a close eye on their students and be responsible for sending them to school healthy. Okay, we'll move to the next slide. And I have some questions here that I thought we could discuss. I'd like to direct this actually to Ms. Forgione. And that is the question about travel advisories. Back in March, there were travel advisories from the CDC that were about international travel. We had a number of students and parents and staff members that had done some traveling for vacation and whatnot. and they were told when they came back that they had to do a self-quarantine for 14 days. So I'm wondering, can you speak to the new travel notices that have been put out by the state and what we will need to do regarding that for schools?
Well, as it stands right now, we have 19 states that have put this, that have a travel advisory. And before long, I suspect that we're going to have 50 states. I really think that we have to really be respectful of this, that we have to have a 14-day quarantine and make, make parents and students accountable. And that opens up a whole nother a set of questions and issues about what happens to those children who are home for that period of time. So again, I always prefer to say that this is all about responsibility and that accountability that parents can take about the travel outside of state. And but I'm sure we're going to have many, many of those situations on a case-by-case basis that myself and the State Department of Health can help you with as we proceed with this. But it will become complex and it will become complicated as we go along.
Okay. Thank you. And Dr. Salaki, can you talk briefly about what we would need to do if a staff member or a student does test positive for COVID-19? As a school, would we have to exclude a student? Do we ever have to close a school, or do we just monitor the other people that may be in that classroom, other students and other staff that might have been exposed? What do we do if someone tests positive?
When someone tests positive, and I think the circumstances, whether it be a business or whether it be a school, is really the basis for our contact tracing systems that have been put into place, mostly I think in our metropolitan area. But first of all, if there's a child that for some reason comes to school and to the discussions that were previously somehow is in there that day with a fever, obviously, as with any child, I think you're going to take them out, have it assessed. And because of the COVID-19 situation, I think you would want to have a place in the school where you could, in some fashion, isolate that individual until proper medical assessment could be done, and whether the child would be sent back home or whether the child would require further medical evaluation. I think that would have to be determined. I think these children, once they're identified, if there is somebody identified as having COVID-19, again, then you start backtracking and seeing who they've been in contact with. Obviously, their immediate class is going to be the first groups that are going to have to be re-interviewed, if you will, and decisions made on quarantining or isolating those individuals going forward. It may be that the whole class may need to do that. Again, keep in mind, we talked about earlier, asymptomatic carriers. People will acquire this virus and may be actually asymptomatic for a period of time, maybe a few days or more. But in that period of time, they are at risk of transmitting that virus. We will wear our masks and things of this sort, but there may be breaks in that, and there may be contacts outside of school that we're not aware of that may have spread it to other individuals. So that we have to assume that that individual has had contact with anyone that they can identify as being close to them, besides family, in addition to family members, students at school. Do you have to close the whole school? If there's one case and it happens in one particular area of a class or a type of, let's say, freshman, senior, whatever, again, your contact evaluations are going to determine how broad the restrictions are going to go after that. But I think, closing down the whole school, if you have over the course of the next, let's say, two weeks, you have now a dozen more cases develop, clearly it's going to warrant, if not already being done, that perhaps even a whole school may have to be closed down until the condition is further identified and controlled. But in the very beginning, one person, I think the immediate contacts are going to be identified. That the first patient is going to have to be isolated as quickly as possible and removed from the area to whatever is appropriate. And then you have to make the families aware that there is a possible exposure and perhaps quarantining that immediate group of students.
Okay, thank you. And then this next slide talks about the return to school policy, and this is a CDC policy, and they've established this for anyone who's tested positive for COVID-19 and then will return to school or to work. Dr. Spiesler, I don't know if you want to jump in, but I was going to read through at least these briefly and say that to return to school, you have to have 3 days with no fever and respiratory symptoms that have improved, and also 10 days that your symptoms have disappeared, and also a written clearance from a medical doctor, or no fever, but improvement in respiratory symptoms, and then 2 negative test results in a row that are 24 hours apart, and also written clearance from a medical doctor.
Yeah, I think all those are reasonable. I think we have to be very cautious about students returning to school, especially with any infectious disease, more so now because of COVID-19. So I don't think that these are unreasonable steps that we're taking in order to get students back to school. I'm just concerned a little bit about the negative tests. Right now, our turnaround time for some of these tests are rather lengthy, and I'm not quite sure whether we want to keep students out of school for a week or 2 weeks before we get the results back. I'm hoping that we're going to get the rapid test more readily available, so we'll be able to really identify that somebody is negative rather than just using clinical judgment.
Okay, and then we'll go on to the next slide, please. And the next topic is about risk and the risks associated with COVID-19. The CDC lists conditions that put some people at severe risk and others at moderate risk. I've listed those conditions on later slides at the back end of this presentation, and we're not going to discuss those tonight, but they are there as a reference, and the slides will be on the Board of Ed website. Maybe Dr. Salaki, could you speak to this, and what considerations should students and staff give to their pre-existing health conditions? We did talk a little bit about that before, but should we require medical clearances for someone that really is at high risk?
The simple answer to your question, yes. I think you need medical clearance for somebody who's high risk. The definition of who's a high risk, can be individualized. But I think if you have a child or a young adult, teenage years that is on immunosuppressive medications for one reason or another, for example, I think that's very important. I think you have to weigh things like diabetes. Especially insulin-dependent diabetes, as a risk factor, which we can't overlook. The fact is that many students and young people with diabetes, insulin-dependent, are relatively healthy. But again, I don't think I would keep them out of school for that, but I think they need to have a clear understanding with their health professionals about what the status of their disease happens to be, since that will vary. There may be some other situations of immune disorders of one form or another that would require this. There may be some developmental disorder conditions, that make it difficult for that child to perhaps perform in a classroom situation. We talked earlier about masks sometimes not being a feasible alternative. So I think that has to be weighed into having the physician and the parent with the child and with the student discuss those things with their caregivers who know the child best, who know their reaction to their disease best, and how they can be handled if they have to get into a situation such as a school environment. And I think with all those situations, I think to sum it up, need to have a close interaction and conference with the primary caregiver of that person, with the family, with the student, to sort of put together the best alternative. This doesn't mean that anybody with these conditions can't go to school, but I think the full assessment of it, how their treatment is being monitored, how their treatment waxes and wanes with their immune systems, has to be assessed and determined of their risk to be in the environment such as a school.
Okay. Dr. Spiesler, do you want to weigh in on that?
Yeah, the only concern that I have is that I think there has to be I think this is a decision that has to be made through the primary care physician, the family, and the student. But I also think that the school professionals need to be involved in this also, and there may be a dialogue that would go on between the school district, the school physician, myself, and the primary care doctor. Some of the primary care doctors may not understand how we're providing education, what the environment is like, and I'm just very concerned about certain conditions that I treat patients for myself that may be okay to go to school, but it's not completely known to the caregiver, and the caregiver gives okay to go to school. But I think there has to be a dialogue set up on an individual basis between the school district and the primary care physician to find out what is the best way to educate these particular children.
Okay. And then, of course, there are students with disabilities or special needs. And I'm wondering if you can share anything about how we can plan to take care of them. They're our most vulnerable community members. We want to be able to bring them into the environment and educate them. So how do we do that?
I think that these students really are high priority. When these students you attempt to do distance learning or virtual learning with them, they're going to really fall behind. So I think what we need to really make special accommodations for them, smaller class size, physical barriers. Certainly they're not going to wear masks. Face shields obviously would help, but I think they need to be given special consideration, and we need to set up classrooms that will be effective in terms of educating these children, as well as the other additional services that they may need, including physical therapy, occupational therapy, speech, and many of those other things that we provide for them in school. So I really feel that these, and especially in the younger age group, the K through 5, K through 6 age group, these are students that really need to be in school, and we really need to concentrate on what we can do for them to minimize the spread of the COVID-19, but at the same time to provide for them with an effective education.
Okay, thank you. We'll move to the next slide. And I wanted to ask Ms. Forgione if she could just speak briefly about COVID testing. There's been a lot of talk about that, whether or not you should have a test, who should have a test, what kind of test should you have? So could you just speak for a moment about when is it appropriate to get a test, and then what test would you get?
The type of testing that we'd be talking about if someone shows symptoms would be a PCR test. And that would be something that when a child is identified, to be sent home, to have a private physician conduct that test. And then, of course, self-quarantine until we get the results, followed by contact tracing. That's when that type of testing in a comprehensive strategic way, we can, along with other things, would be a useful tool for us. But testing just to test and to do it just across the board has really very little, I think, results for the greater good. I think a comprehensive plan that also promotes good behavior, reducing the spread of the disease, maintaining a healthy environment, and preparing for when someone gets sick. What we also know is that the antibody tests, a lot of that information, really we've gotten these tests, but what do they really mean? Are those antibodies just for the moment? Are they long lasting? Do they have an impact on others around them? So I would really not look at any kind of antibody testing, nor would I consider just massive testing within the school, but use it more on a case-by-case basis as students develop symptoms, and make it a more comprehensive approach.
Okay, great, thank you. So we're going to jump ahead, and just because the night is getting away from us, and I know that people have questions, I thought we would, Mr. Markarian, if you could advance. I would just like to thank, obviously, the panel for your participation and for your time tonight. And I would like to ask you if you could each just take a minute, maybe, and talk about what's the most important thing that you want us to know. What do you want us to take away from tonight? Maybe we'll start with Dr. Spiesler. If you could just give us maybe one highlight or one point that you think is important, that would be great.
Yeah, I think everybody needs to, the take-home message here that this is a serious illness. We don't know a lot about it. We're learning more every day about it. We're learning that it's certainly a aerosolized transmission. Close contact is the way that this thing gets from one person to the next, and it's a very serious disease. And it doesn't attack just the elderly; it attacks young people, as we're seeing, and it's basically because of an immunological response of that particular individual. So I go back to what Dr. Frieden said: the 3 W's: wear a mask, wash your hands, and watch your distance. And I think that really is the take-home message that we need to really drive home to everybody.
Thank you, Dr. Spiesler. And Ms. Forgione, would you like to share your wisdom?
I think one thing to remember is that schools can go remote at any time, depending on what is going on in the current situation. We are monitoring it very carefully. I also want the schools and administration to know that we are partners with you, always have been, and along with the State Health Department, we can help you along the way. Until an effective vaccine is available against COVID-19, I think we must behave as if every person we come in contact with has that disease. And our best defense will be these simple things as wearing face coverings, keep social distancing, practicing good hand hygiene, and staying home when sick, and making our community, parents, students, and school family accountable for and responsible for what they do every single day.
Thank you so much. And Dr. Salaki?
Well, I think the best thing we can come away at this point in time is that this disease is new, that all of us in society are in it together, and it's up to all of us working together that we're going to control this virus and to minimize its risks for spread, and that we are hopefully at best maybe a year away from having maybe effective treatments and vaccines that are going to control it. But until that time, I think we have to follow the guidelines that are out there. As Dr. Spiesler said, I like the 3 W's: wearing the mask, washing your hands, and keeping your distance, etc. These are very important things. They sound rather mundane, but these are the things that we have as our defense right now and to fight this virus. And if we use them, we have seen, I think, in our area, fortunately, the pain that goes into doing those things, but also the benefits that we're reaping from it. And we have to be aware that this is not going to disappear immediately, but if we keep doing what we're supposed to do, we can minimize the damage from it.
Perfect. Thank you so much. So at this time, I'd like to turn it back over to Mr. Markarian.
Thank you, Rita. Thank you very much. So at this point, we would normally ask the Board of Education members if they have any questions for the panelists, but I'll turn it over to Ms. Gray because I think maybe she wants to do some public comment.
So if there's no objection from the Board of Education members, I've been in contact with Ms. Fox, and she's informed me that we have a few dozen public comment. So I thought maybe we could try to get through some of that while we still have our panelists here. Is there any objection to that? I see no objections. Speak now. Thank you, everyone. So Ms. Fox,
Sure.
if you're ready.
A little more than a few dozen.
Okay.
So the first one is from Liza Davidov, 89 Fairview Drive South. Hello, my name is Liza Davidov, and I'm a resident of Basking Ridge and a mom to 3 school-aged children, Oak Street, Wams Ridge. I'm also an ICU RN for the past 21 years. This spring, I worked the front lines taking care of the sickest COVID patients in my ICU at Robert Wood Johnson University Hospital in Somerset. At our surge, every single one of our 45-bed ICU was occupied by the sickest COVID patients. I'm writing to share an idea to help reintroduce our kids and staff to an in-school setting while still reducing COVID spread, the face shield. A plastic face shield is protective, comfortable, and has many advantages to cloth masks, While I support the cloth mask initiative, they can become hot, uncomfortable, and restrictive after an hour or so, which is why I don't think they are realistic for children all day at school. Face shields are much more comfortable to wear for longer stretches and feel much like sun visors. One's mouth is protected, but nothing is physically touching it. I've emailed a separate photo of a face shield. My kids trialed mine and agreed they felt really comfortable. Secondly, they provide an excellent barrier to COVID and other droplet particles. These plastic shields cover not only the nose and mouth, but the eyes, which have been known to be entry points for viruses. Droplets expelled by the wearer are caught on the shield and not expelled. The shields are very easy to clean with soap, water, or rubbing alcohol and are reusable. Cloth masks, once soiled, must be changed out. Also, the face shield offers superior protection to cloth masks. Cloth masks are known to catch up to 30% of droplets. Although there have been less studies on face shields as a standalone barrier, one recent study found them to block 96% of influenza droplets. Study is linked below. When speaking of protection, it's also important to note that the face shield offers reciprocal protection. That is, protects others from your germs and it protects the wearer. This is not the case with the cloth mask, as it serves to protect others but offers no protection for the wearer. In terms of application, there is really no way to mess up placement of the face shield. They are so easy to put on and they stay put. This is not the case with masks, which can slide, fall off, causing a reduction in their effectiveness. Now let's look at the social and emotional effects of face shields versus masks. To me, the shield, because it allows for full visualization of the face, is so much friendlier than a face mask. Teachers and students could actually see each other's kind faces and smiling expressions, making school a much more approachable and friendly place. Our students with special needs, sensory issues, hearing impairment, and autism would benefit greatly from wearing face shields, which is another benefit. Lastly, face shields do not fog up your glasses, unlike masks. Face shields are very easy to manufacture, to obtain here in the USA, and are a very economical choice for our already cash-strapped school districts. Because they are reusable, they are a great investment. I agree they take time to get used to visually. It's sort of a welder look, but we've gotten used to masks, so I don't see how we can't adjust to face shields. I'm including links to a few studies and a JAMA editorial promoting the application.
Excuse me, Ms. Fox, I just want to let you know it's been 3 minutes, and I know you've got dozens of comments, so I just wanted to...
That's pretty much the end. That's pretty much the end.
Okay.
She just left her phone number for questions. Thank you. Next, Christine Huff, 16 Post Terrace. I would like to first express my family's sincerest appreciation to the incredible teachers, staff, and administrators of Bernards Township who have successfully navigated this uncharted territory and supported our children through such a challenging time. As you and they move to evaluating a safe reopening, I am certain much of the conversation will surround keeping the students safe. What measures are on the table at this point? In addition, and equally important, what can and will be done to ensure the safety of staff and faculty as well? Finally, what can we as parents do to support you in your mission to continue to safely and effectively educate our children? Next, Joshua Scribner, 6 Lincroft Drive, Basking Ridge. We anticipate challenges for elementary school students to universally adhere to the safety measures necessary during this unprecedented time. As parents with the ability to supervise our student at home, we are advocates for 1, a fully remote option in which the student is assigned to a district-wide remote class taught by a teacher dedicated to that class using a measurable curriculum and with the ability for students to remotely socialize with peers in that class. This alleviates pressure on in-building classes and reduces risk for all students. It aligns to similar approaches taken by districts in the tri-state area. 2, moderators that assist teachers during any remote learning to ensure teachers can focus on teaching. 3, the onus of teaching is on teachers, and parents assist only in a coaching and parenting capacity. Thank you for considering these suggestions.
Ms. Fox?
Yes.
So public comment right now is supposed to be for the panelists. We'll have a separate public comment for other items later.
Do you want me to stick to health issues?
If we can stick to the health issues, that's what's on our agenda. And so,
okay.
You know,
They tend to have multiple issues, but I'll do my best. That one's education. Education. So this is from Lu Hongji, 7 Plymouth Court. Since 200 plus experts now declare that the coronavirus can stay in air for hours in tiny droplets, the risk is very high for students once they get back to classrooms. What are the extra safety measures to address the airborne virus implications? And will the parents have the option to keep their children home and have live teaching style online learning? I mean, they're not really asking medical questions, but they're medical questions related to the students being in school, if that makes sense.
Right. So I know you have a lot of public comment there, but we're also trying to respect the panelists' time. So maybe as you're looking for medical questions for the panelists, we could ask our panelists if they could respond to the ones that we've heard so far. There were two. One was this concept of face shields over masks, face shields versus masks. And the second one that we just heard was about droplets being in the air for hours.
I could make a comment if you want me to. I don't know.
I'd appreciate any feedback you could give us on some of these medical questions, either Dr. Spiesler or Dr. Salaki. That would be great.
My brief comment on the shields, I think, first of all, I don't know if I'm not aware of enough good data comparing that with masks as far as droplet exposures to other individuals. I'm sure there's limitations of the droplet exposure, but I have to believe that the data, at least that's out there right now, seems to more favor the mask aspects. Masks can be washed, obviously, every day. They are more uncomfortable. I don't deny that, especially this time of year when it's warm. But I think shields have a purpose, but I don't think the purpose should be to try to limit the spread of this virus in the public arena as we need to do. The other question I just briefly said, I alluded to it before. I think when we have students that are cohorted in classrooms, we need to have adequate ventilation systems, meaning airflow in, airflow out to those areas, which I think minimizes the lingering of any droplet pathogen for those reasons. And I think proper aeration systems, and again, I'm not the expert in engineering on this, but I think if they're set up in such a way like other buildings may be, that may be the answer to that question.
Thank you.
Yeah, in response to the face shield versus the masks has always been the gold standard. Even in the hospital setting where we may or may not be exposed to this particular virus, a mask, a face shield is used in conjunction with a mask. I don't think it could be used as a substitute. I agree with Dr. Salaki that I don't think we have adequate studies to show the effectiveness of a face shield versus a mask. But there are certain advantages of a face shield aesthetically, but I don't think it's going to afford the protection that we're looking for in terms of the transmission of this disease. The other aspect about ventilation is extremely important. We're seeing now what's going on when they opened up these bars and nightclubs in New York that don't have adequate ventilation system. The incidence of COVID-19 has skyrocketed. So as soon as and we know that even on the beaches, this virus can live in the air for long periods of time, and they can be traveled on through many different situations and air currents. So the thing that we should also be looking at is looking at our physical plan to the HVAC systems to make sure that the filters are clean and that we're making sure that we clean the air the best we can in light of the fact that a lot of times, a lot of these classrooms, the windows cannot be opened.
Thank you.
Could I just add one thing? I did look into face shields myself just to see if there were any studies out there on the efficacy of face shields. And from what I've read, because obviously you look at them and say it would be much better to wear a face shield than a mask all day. But, when they measured the inhalation, aerosol inhalation, the efficacy was only at about 23% for face shield compared to the masks that we were talking about that were more about 85%. So the risk to the wearer is much greater with a face shield because it's open. I mean, it's just open on the bottom and the sides.
How are you doing, Ms. Fox?
A couple more. So Roger Marion, 225 Stone House Road. Could the experts please comment on 1, the danger of vent masks which do not filter exhales and why they must not be allowed? 2, why wearing a mask must be defined as covering the nose as well as the mouth, and covering the mouth alone must not be permitted. And 3, how lunch table dividers can contribute to minimizing transmission. It is my goal that the board would consider their responses carefully. Can I read the next one?
Why don't we take 2 at a time?
Okay, here's one more. This is Sundari Rao from 5 Ross Lane in Basking Ridge. Since one of you mentioned about the spike in cases since Memorial Day and July 4th, is it from the senior living or regular households around town?
Dr. Spiesler, you think maybe you could comment on vent masks and covering nose and mouth?
Yeah, I think that's an extremely important topic, because as I look around, I kind of laugh. I see people with masks and the masks are below their nose and they're just covering the mouth. That's completely ineffective. We know that this virus attacks the nasal mucosa. It's entered through the nose. The nose has to be covered. Just covering the mouth is just not adequate. It's almost as good as wearing nothing at all. So you have to wear a mask. Does it have to be an N95 mask? Not really. In fact, in my case, because I have a beard, an N95 mask is not effective for me. An N95 mask has to form a complete seal around the nose and the mouth. And these masks that have these exhausts, what they're doing is that it's protecting the wearer, but it's actually exhausting your particular breathing out into the environment. So I think that these kind of vent masks really should not be allowed. They're for the comfort of the wearer, but they don't protect the people that you're in contact with. So I think they're extremely, extremely dangerous. You'll notice that there's no N95 masks that have an exhaust port on them. Only the N95 masks have a complete seal. Many different kinds of them that are there, but they form a complete seal around the mouth, and there's no way for the exhaust to be getting out. In terms of the plexiglass shields or shields, I'm a firm believer that any kind of barrier that you can construct will actually serve the students and the other occupants of the area well. This virus needs to be traveled through. It's airborne, and as soon as you establish a physical barrier, you stop the flow of this particular virus. So plexiglass, any kind of barriers at all, will certainly stop it. And especially in an area like in the cafeteria where students need to eat and obviously can't wear a mask, those physical barriers will certainly help decrease the transmission of this virus.
Thank you.
I would agree with Dr. Spiesler on both the issues of the mask, and I would just add to the plexiglass shields that these are items again that need to be cleaned periodically, so that I would not lose sight of that fact just because it's like a table surface. I think again that would be included in what you do in your cleaning process.
Thank you. And Ms. Fox, I'm sorry, the second comment I think was about, do we know where the source of the spikes?
Recent spikes that were mentioned by one of the presenters.
I think that was me.
I think that was Lucy.
Well, the recent spikes that we've seen have been 20, 30, and 40-year-olds. And I think it has a lot to do with being able to be out and go to different people's homes and socializing more. Some of the recent protests that people have attended, things of that nature. So we're talking about public gatherings. We also know that restaurants are not opening right now, that they're mainly all outdoor dining for the moment, and that has contributed to the the indoor dining in other states have contributed to the spike, but locally, it's mainly what I think. I mean, we've also done contact tracing of these individuals, and it looks like the majority of them, not that we've had that many here in Bernards, but with the 6 communities that we manage here at the health department, it has been mainly from being out in public in large gatherings.
Thank you. Ms. Fox?
So Ken Swan, 60 Linden Drive. Is there proof that children can spread the disease? They don't seem to get sick. How real is the concern of children being asymptomatic carriers? What is the number?
No, I don't think we have the absolute number for that. We know that children are a special group. There are cases of reporting this mucocutaneous lymph node syndrome in a number of cases. People know it as Kawasaki's disease. These have been anecdotal reports. I have not seen any of those. But we are concerned about the children harboring the disease. A number of epidemiology reports that I have read actually say that we're waiting for everybody to be colonized with this thing. Once everybody is colonized with thing and we get an effective vaccine and even a treatment, that this thing will eventually become just another virus that everybody has, and they'll get what they call the Teflon effect, whereas you get it and it gets, you slough it off. You may get some slight upper respiratory symptoms, you may be asymptomatic, but you're not going to get this horrible clinical manifestation that we're seeing. But this is going to take time. Most of the experts and the reports that I've read say this won't be effective, or we won't see this at least for another 18 months or until 2021. So we have to be cognizant of that. There's a natural course of this illness. You can't short circuit it. No matter what you do, the virus is going to be there. And unless we're compliant as the issues that we discussed this evening, this virus is going to continue to increase. As we've seen in New Jersey, Monday, the Commissioner of Health, she reported that there was 10,000 new cases in New Jersey. That's completely unacceptable.
Jackie, do you want to speak to that issue of children as carriers?
I'm sorry, you're referring to me?
Yes.
Oh, I'm sorry. Well, as I said earlier, I mean, we don't have a lot of studies yet of testing on young children, let's say, especially under the age of perhaps 10 or 12. And I think that's one thing that we have to accumulate to get an idea of how many of these children may be asymptomatic carriers. We do know, obviously, from all the testing that has been done, mostly in adults, that we do have a not terribly insignificant number of people with being asymptomatic carriers. So why children don't get this disease or don't have the symptoms maybe as adults have, I mean, there's been a lot of theories. The coronavirus itself has several strains, maybe a half a dozen, I think, to date that we know affect humans, and 2 or 3 of those strains in general have been known for a number of years to cause what we would call the common cold. So is it because of immunity that's been achieved in some of our youngsters from having had other strains of this virus that cross-react? That's something that we still haven't defined yet. And I think as the science of this develops, we'll be able to know more about that.
Thank you. Ms. Fox?
So Sundari Rao, 5 Ross Lane, second question. But how will our school differentiate between flu season symptoms versus COVID symptoms, as fall normally does have many children affected with allergies, stomach bug, diarrhea, to name a few? And then if a child reported fever, does the entire class require to quarantine? How will the school maintain the 3 to 6 feet distancing in the hallways?
So maybe Rita, you want to speak to sort of our standard response in terms of, symptoms that kids have.
Sure, I would love to. I think on behalf of all the school nurses, they would appreciate me reminding everyone that we have child sickness guidelines that the school nurses put out every year. We'll be sending out a packet in early August, and those child sickness guidelines will be in there. And they really list a number of symptoms and the things you should look for. And if your child has any of those, they should stay home. And that's not only to take care of them, but also to be responsible so that, as we mentioned before, your child's not coming to school with a fever or a cough and getting someone else sick. So, you know, the administration here can do a great job planning to try to get everyone back into school, but if people send their children to school sick and get other people sick, we're going to be closed. So I would ask everyone to look for those child sickness guidelines. They're on the website, on the Board of Ed website as well, but they will be coming out again in August.
Rita, may I also add that having the children vaccinated against the seasonal flu is very, very important. Therefore, we could rule out if it's flu or something else. And in addition to that, if a child is sick, to keep your child home, but also when they call in for the school to have very good logs about illness and ask about the reason for the absence and is a child being seen by a doctor and the symptoms. I think those are all very important that could paint a picture for us to then follow up and do any kind of necessary testing, for instance, and then subsequently, you know, the contact tracing that will help us, you know, achieve some of the goals to keeping the kids safe.
And all of the school nurses work in conjunction with the health department. So they certainly would let Ms. Forgione and the health department staff know if there's any concerns. We will send any child home that has any of the symptoms that are associated with COVID-19 or with flu. I mean, as we go into flu season, as the parent asked the question, any of those symptoms, which there's definitely across, right? Some of them are very similar. Any of those symptoms will require us to send a child home.
How are you doing on medical comments there, Ms. Fox?
Here's a medical comment by Q Shen, 80 Spring Houses Lane, Basking Ridge. She says, my name is Q Shen and both of my kids are middle school students at WAMS. We understand that it is hard to have a perfect solution. However, for everyone's safety, I hope we could have a flexible plan. She said, based on a recent study by the CDC, and she provided the link, classroom interaction between an infected teacher and students might result in virus transmission. To remain a safe environment for everyone, please take a serious consideration that lets students have an option of distance learning. So I thought that was not a direct question, but a reference to a study about the rate of infection between teacher and students, from a teacher to students.
From a teacher to students.
I can make a brief comment on that, and that would be, I think teachers as well as the students that we're talking about tonight should be wearing the masks that we talk about, they are getting their temperature checks, in this case at school. So I think the screening mechanisms that are in place for the school system in general, for students, I think applies to the teachers, so that all we can do is minimize the risk of exposure of teachers in their environment as well as we can for the students. Are there going to be situations where a teacher, for one reason or another, unbeknownst to them, gets exposed and becomes an asymptomatic carrier? I think that is a probability that we have to live with. The fact that they would wear a mask and have the usual distancing situations with their students, having that maximize as we do with the students, I think works in the same way with the teachers and would minimize that spread to the student body.
Thank you.
There's a series of questions here about medical situations, but it's more about what the district response will be to them. So I think I would hold those, correct? Less about the medical.
Are you talking about like testing positive?
So for example, yeah, what would happen to a class?
Right. So I think we talked about that a little bit in the presentation. Ms. Sarabera had that in there. And you know, if I recall correctly, I think a lot of that has to do with looking at the situations individually and working with the health department. I know that Lucy spoke to that piece about communication. I don't know if anybody else wants to weigh in on that, but I think that's where our policy writing is headed.
I think in terms of situations that involve medical conditions, and I had a discussion with Rita previously about that. I think each case needs to be individualized. It needs to be discussed like within the healthcare professionals, and also bring in the primary care physician if there's a health condition that we're concerned about, as well as partnering with the local health department. I think all the stakeholders need to be involved. And I think we need to look at all these factors before we say yay or nay to a student that can or cannot attend school.
I believe that's all of the medical questions. Although
Okay.
some, like I said, are related to policy as a result. Yep.
Right. So I just wanted to share, because I realize we did get a little bit of a late start. We were looking at an hour and a half maximum on the panelists to respect our doctors and our panelists' time. So I certainly appreciate trying to focus the questions for our panelists. I'd like to suggest perhaps that all of the public comments that perhaps that we didn't get to, that we can create a Q&A on all the medical issues. I'm sure that we can do some collaboration perhaps with Rita and Dr. Spiesler and try to work together to make sure that we're doing the best we can to answer people's questions with regard to medical issues. Obviously, as I heard from the doctors and from Lucy, there are things that we just don't necessarily know yet, but we can certainly do the best that we can to try to put together answers for folks on some of those items if we didn't get to them. We discover them as we get through them. Does that seem reasonable, Ms. Gray, Mr. Crute, at this stage? Perhaps to thank our panelists and move on at this point.
Absolutely.
Maybe perhaps as a last round, if any board members have a direct question for our doctors before they sign off, or for Lucy.
I'd just like to say thank you to everyone. We really appreciate your time and all the information and the work you did to put this all together and bring all the detail and wisdom that you have. We really appreciate it.
Thank you. Enjoyed being here.
Thank you guys
Thank
for
you for
being
the
here tonight.
opportunity.
I just want to make one final comment. I think everybody needs to understand, and Dr. Salaki mentioned it, and I think it's worth mentioning it again. We're all in this together. We're here for the safety of students. And as your school physician for too many years that I can count, I'm here to help you. I'll serve as a resource. Rita knows that. I have a close relationship with all the nurses, and we're here to make the best possible educational decisions. And as a former Board of Education member, I switch hats many, many times to make sure that we're making those decisions in a very sensible and cohesive manner, so that we can provide the best educational advantages for all of our students, and to make sure that everybody stays safe.
Thank you all very much. Of course, you're welcome to stay if you wish, but I understand you probably have a lot of other obligations you need to deal with. So thank you all. Thanks to our panelists. We appreciate your being here tonight. Thank you so much.
Thank you for
Thank you.
inviting and have
Thank
good
you.
evening. Stay safe.
Thank you.
Okay, so I'm looking at the agenda. I'm not exactly sure where this puts us. Are we tabling all public comment and pulling together a Q&A for any and all questions?
No, I think the intent, Ms. Gray, was our agenda was focused on public comment on health issues. That was the order of the agenda. And so that's why I was
Right.
trying to focus the public comment on the health issues, and then we have another opportunity for public comment
Okay,
at the end.
okay. Gotcha. I see what you're saying. So then with that, our next item, number 8, is return to instruction staff and parents survey results.
Correct. So I'm going to share screen here and bring that up. Actually, Ms. Fox, were you able to do that?
Yes.
That would be great. Okay, great.
Look all right?
Thank you. Thank you. That's great.
Okay.
So, you know, at this stage of the game, we kind of work together as a collaboration. Really, all the administrators have been putting a lot of work into thinking about a lot of aspects, obviously, about returning to school. It's been, you know, the main focus really for months. So myself and Ms. Fox and Mr. Syatt will have the privilege of trying to communicate some of what we've been working on with you. So the first thing, if you want to advance the slide, Ms. Fox, is to kind of talk about surveys. And the reason that we wanted to start with this is because a lot of our thinking has been about trying to understand, you know, where are people's minds? What's the mindset out there in terms of people's intentions, really, about trying to get back to school, all factors considered, their own situations and so on. And as we try to come up with a plan that is doable for the fall, having a handle on the available staff and also a handle on the number of students that are likely to be in the buildings in the fall is obviously a key piece of information for us. So we made an effort to try to gather some of that information in terms of which staff members do we expect to have, what are the variables that impact whether or not certain staff are able to work in person in the schools, and also the same for our students. You know, which students, what are the variables for them, and how many should we expect to have back in the fall. So with that, I'll ask Mr. Syatt to share some of the results that he's been working on with respect to our certificated teachers.
Great. All right. Thank you, Mr. Martin. Good evening, everybody. So, you know, this has been something that we knew we needed to do. When we talk about staff, we had actually completed a staff survey middle of June, and that was really for our entire staff. And that was to get a sense of where their minds were as they were leaving the school in terms of a return. But we knew that when we did that, we would want to do a more specific survey about where people felt and where their heads were at as it relates to return to instruction and return to the building. So what we're doing is we're doing staff surveys in phases or waves, if you will. So in the last week, we sent out a staff survey specifically for our certificated staff. And so for folks that aren't familiar, those are folks that hold a New Jersey Department of Education license. Those would be teachers, counselors, occupational therapists, et cetera, anyone that holds a certificate. And the reason that we surveyed this group specifically first is because, as Mr. Markarian referenced, it's important to understand where they are, and that will help guide what instructional plans then we're able to put together. So that's the rationale and the thinking behind the certificated staff survey. So if you could forward the next slide, Ms. Fox. So as I mentioned, this was a follow-up survey to a survey conducted back in June 2020, but again, that was for the whole staff. I can tell you at that time, when we administered the survey back in June, we were at 2/3 of the staff saying they were comfortable returning and 1/3 saying they were not comfortable. But again, we weren't asking people to give any specific reasons yet at that time. So this survey that we did in the last week, again, for just certificated staff, in our district, we have 553 certificated staff members across all of our buildings, and pretty good response rate considering that we did it right before a holiday weekend. And I am going to make sure I follow up with those 8 folks that didn't complete the survey so that we have 100%. I want that 100%. So again, of the 545 that we had respond, we had 460 who indicated that they would return to the buildings. They would return in person. Although there is a caveat when we look at that 460, and it's an important caveat, and it's one that I'm sure many of our parents are also dealing with, and that is the issue of childcare. Many staff indicate it is their intent to return, but certainly one of the wild cards for everyone is the issue of childcare for their own kids, of course. And so I'll speak to that a little bit more in a later slide. But then we look at the 85 staff members, or roughly 15.5%, who report that it's their intent to teach or work remotely. And so this is really where we need to do follow-up, and I plan to follow up with these folks. These folks will need to be counseled on appropriate leaves that they may be eligible for, and they may also need to have a discussion not just with myself but also with their union leadership about some of their options. What's interesting from these 85, and again, not a huge number, but from the 85, 57 of those staff members were from grade 6 to 12, so about 2/3 were from our middle and our high school. And so one of the things that is something new that all of us HR folk are working through in the state are putting together a process to approve what could potentially be some unique types of leaves, some leaves that we haven't necessarily approved in the past. And so we are going to be working with our district physician, with Rita, with our union leadership to put together a process for staff to be able to apply if it's appropriate for a potential leave. Again, if it's appropriate, which I'll speak to again on a later slide. Next slide, please. So, this is really important, this slide, because this really speaks to some of the things that are guiding the staff whose intent is to return, whether it be return in person or because of these factors, they can't return in person. And so when we asked and when we talked about the survey with staff, one of the questions we asked is, if you can't return, why can't you return? And so these are the top reasons why staff indicated they couldn't return. It was their own health, because they have an underlying medical condition per the CDC guidelines, which is changing. I check that page rather frequently, and I can see that page is being updated almost weekly. And I understand they're coming out with some new guidelines, so I don't know whether that page will change again. The other thing that many staff report is that they themselves may be healthy, but that they have a family member at home who is compromised in some way, and there's a concern there. The other thing that I mentioned, and this is the big one, is, this is the most frequently given reason why staff might have trouble returning, and that is their individual childcare challenges, whether it be a childcare center that's closed because of COVID, a childcare center that is limiting the number of students who can return, or a childcare center or provider who is limiting hours. So they don't have necessarily those wraparound hours that they had in the past, where they could drop off early and they could pick up a little bit later. So they had the flexibility to be in school a little bit longer. So that, to me, is the biggest challenge, and a challenge that is addressed by federal law, which we'll talk about in my last slide. And then the last thing, which is interesting too, somewhat related, is that issue, sorry, Ms. Fox, sorry about that, is the school schedules for their own children who may not align with the Berners Township schedule. So of course, we've got staff who live all over the state, some live out of state, and all school districts are not going to be in unison on schedules. We know that. School districts will have different times, different schedules, and so their own children may be on a different schedule than the schedule they have now, and that may impact the childcare situation. And so that's something else that is somewhat connected and married to that childcare challenge. Okay, now the next slide, please. And so this is something that staff, I'm sure, if they're not aware of it already, this isn't new. This is now an act that is 3 months old. It's the Family First Coronavirus Response Act. It's tied or married with the FMLA, which is a leave that staff have frequently taken, typically to if they are going on maternity leave or they have a sick relative, a sick family member they're taking care of. But what the FFCRA, we like acronyms, does address is that up until December 31st of this year, a staff member can take an emergency leave of up to 12 weeks if they have a childcare situation that's been caused in some way by the COVID. And that could be a childcare center, those reasons I mentioned earlier, a childcare center closing, a childcare center's hours being impacted. And so with this act, what's unique about it is that they say reasonable notice must be given. However, there isn't a limitation on the number of days or weeks that a staff member can give to give us notice for this. So that is going to be a challenge all school districts across the country will be facing when it comes to a potential leave. And I would anticipate that will be the most frequent leave request that we see, given the fact that most staff who answered their intent was to work remotely stated that it was because of a childcare issue. So, as we look at these issues, we also start to look at another really important group in our district, and that is our substitute workforce. We know with the uncertainty with staffing, in general, our workforce of substitutes has always been critical because that, as you know, is the daily fill. When we have a staff member is out, we're filling them with a substitute. Well, in this climate, we may see staff members, we hope that this doesn't happen, but if a staff member gets ill for a prolonged period of time, or we have a situation where we have a number of staff who might be intermittently out, the need for substitutes might be more critical for us. And so, you know, one of the things that our office has been doing is looking at the sub workforce. We're going to be appointing our subs in August. We are at 178 right now who have committed. And as important, we have 8 sub nurses. And I know that, you know, that's really critical for us. And Rita, I'm sure, shaking her head on that one. And then, you know, the other thing that we plan to do, in fact, we started today, we're going to also survey our administrative group and ask the same types of questions. And then, just as important, the non-certificated staff, and that would be a group made up of all of our instructional aides, our school aides, and our secretaries, and ask them the same types of questions. It's really important that we do have equity in this process. And again, there are federal laws and state laws that we must adhere to around leaves. So again, very delicate, sensitive, confidential information around health and childcare that we're going to make sure that we handle appropriately. And obviously our goal is to staff as best we can and also balance that against the federal and state mandates. And that's in a nutshell where we are with staff surveys.
Thank you, Mr. Sine.
Sure.
So as our parents know, and I have to thank our parents for doing such a great job with this, we also tried to get a sense of where their mindset was. And so we sent a parent survey out, and again, before I guess roughly the beginning of last week. And I just want to thank everybody for taking the time to do that. We're probably at a response rate for around 80% or so of our students, probably a little bit better than that, actually. So Ms. Fox, if you wouldn't mind connecting to the data screen here, we could take a quick look at some of the basic results that we had from this survey. And you know, the basic question, as we did with the staff, was, what are you thinking? What is your current intent? And so there's the question you see at the top. You know, anticipating some circumstances involving needing to implement social distancing in our schools, what's your current plan? You know, what are you thinking right now? This was not designed to be any sort of contractual commitment one way or another, but for us to have a sense for planning. You know, what was the expectation in the numbers of families that expected to send their children to school or not? And so, you know, in a nutshell, you're looking at roughly an 80-20 split in terms of the percentage of families that would intend to send their children for whatever in-person schedule we were running, and, you know, 20% saying, you know, I'd really rather not at this stage send my student to school. I'm thinking I'd be better off keeping them home right now. So the other bar graphs that you see going across the screen are breaking out that information by school. You know, how did it break out per school? And you can see, depending on the school, you could have, you know, anywhere from 10% to some of the other schools maybe having closer to 30 or 40%. So there was a decent amount of variation there. And as Ms. Fox is kind of showing you. And then when you look to the right, it just breaks out the same information by grade. And that kind of evens it out a little bit more. But, you know, you've got the same ballpark, you know, roughly anywhere from 15 to 25% on a given grade level, typically saying that they wouldn't really intend to send their children to school right now. Handful of folks saying that they would withdraw their student, and you'll see that's most noticeable at the kindergarten level. Perhaps families thinking that they would wait a year before they sent their child to school. We will make this accessible to the general public, which makes it easy to filter out even by a school. If you want to break it down into the school level, it's simple to do from the drop-down menu at the top. But the takeaway message there is roughly 80-20. Scrolling down there, we took a look at the reasons why folks would not feel comfortable sending their child for in-person instruction in the fall. And there was several reasons, largely associated with other children who perhaps were, the perception that people wouldn't be able to follow rules, wouldn't be able to social distance, and being concerned that because of that, maybe there would be a risk. And in some cases, folks were worried about their own child being able to follow the rules and protect themselves. Obviously, personal health conditions of the individual child, or maybe the health conditions of an adult, maybe an adult member of the household, and a concern that a child might bring something back to the home, to a grandparent that may be living in the household. You'll notice the total count there of 947 is larger than the number of folks who responded they wouldn't be sending their child to school. We think that some folks answered this question even if they were planning on sending their child to school. So not quite perfect alignment there, but such as it is with surveys. Ms. Fox, did you want to, thanks, jump to the second page? Finally, we asked some questions about transportation and technology, largely because, if we're going to try to create social distancing, we want to try to create it on school buses as well. And so we asked some questions about your intention for riding the bus, and are you someone that rides the bus regularly or is assigned a seat on the bus because you're far enough away from the school to have a seat, but perhaps you'd be willing to drive your child to school and waive that seat just to help space out the passengers on the bus. And frankly, it was nice to see that a lot of folks seem like they'd be willing to do that. If you look at the second chart there, you're talking about roughly 18% of the folks answering that question were willing to waive busing for the year. Now, maybe that's a lot of seniors. I don't know, because certainly we know that lots of seniors would be likely to drive to school, and waiving their seat could certainly help in terms of creating space. The last question on the right there was about technology. We anticipate that we would like students be able to have a device that they can transport back and forth between home and school. So we asked if folks already had that type of device, a laptop, a Chromebook, etc. Many parents already had that for their children. Many parents indicated they would like to be assigned a Chromebook. So we wanted to get a sense of that. In the event that we tried to achieve that, would we have enough Chromebooks? And I think we would, based on that survey response. We tried to get a sense on the left there about the different activities that people would support in terms of various measures to try to improve social distancing or mitigate circumstances. Generally speaking, people were favorable in a lot of these areas. And finally, we offered up an open-ended section where we pretty much said, tell us what else is on your mind about reopening schools. And what we did here was essentially categorize into 40 different buckets, which is a lot, but we had thousands of comments. So we read through all the comments, sorted them out into 40 buckets or so, and you could see certain topics were common, right? Largely about cleaning and safety was a huge area of response. So what we did was, and of course we'll share this with folks, you can go through this in detail, but if you want to stop sharing this particular and return to the other slides, Ms. Fox, we tried to summarize, even though we sorted out into 40 different buckets, all those comments. We knew that was a lot to kind of bite off and chew in this presentation. So we sort of tried to take those 40 buckets and filter them into a smaller set where most of the comments seem to fall. So we came up with health and safety, better instruction, support a hybrid model, logistics and operations, wanting a full return to school, and SEL. So obviously the biggest area that folks wanted to address were health and safety concerns. Many comments about masks and shields, comments about social distancing, things about cleanliness, how often things are being cleaned. The second bullet point there spoke a lot with respect to the issue of anything that is presented in virtual mode or distance learning mode, where content or instruction is happening from afar. And we saw this when we had some survey data from the spring about our distance learning model, where folks were looking for more direct live instruction, more time live instruction. So a lot of those 254 comments were in that area. And then we had folks that were supportive of a hybrid model, which essentially is a combination where the job gets done by doing some teaching and learning in school and some learning at home. 158 comments on logistics and operations. How are you going to get the kids in and out of the school? Are you going to be able to spread them out? How are you going to handle lunches? Things of that nature. There was a population of folks that expressed an interest in some fashion of a full return, coming to school every day for a full day of school. Everybody should come back. So that was a fairly common response. And then lots of people had various comments for SEL. And roughly 10% of comments were scattered all over the place in other areas, which you can see if you want to take a look at the more detailed report that we showed a minute ago. So that gives us a sense, roughly speaking, the staff were, 85-15 in the breakout, and the students look to be about 80-20. So at this point, with that in mind, we started to have conversations about what type of model might we be able to institute to meet the students' needs, to meet the community's needs, to meet the staff's needs. And so, of course, we've been working on this in internal committees and trying to work through the host of issues, right? And I'm sure you can imagine that every idea goes down a rabbit hole of all the problems that come up with it and what solutions it might offer. So we did have some discussion starting in the curriculum committee of the Board of Education, knowing that the way that we deliver instruction fits with the Board of Education's curriculum committee responsibility. And so we did have a meeting about that. And I believe at this point in our agenda, we have an opportunity for a report out from the chair of our curriculum committee on what we talked about at the last meeting.
Yep, hello. We mainly we met on July 2nd, which was last Thursday. We mainly spent the majority of the meeting talking about the return or the road back. But there were two small things that we discussed first. One was AP scoring. There was a concern brought to the committee about the validity of the scoring of this year's AP test. Jen Reefields, a supervisor and reader for one of the AP tests, explained that due to the new online format of this year's test and to ensure validity and reliability of scoring, a significant amount of time went back into back reading, training, and scoring many practice tests before readers were permitted to score live tests. Some of the tests required written responses that required use of critical thinking skills to prevent students from just Googling the answers. The AP scores are due out July 15th, and if a student doesn't agree with the score that they receive, there is a process for them to appeal. Next, Ms. Fox and Ms. Reefields were going to be meeting on July 3rd to further discuss the petition circulating throughout the community requesting the district to implement an anti-racist curriculum. Since that meeting took place after we met, I'm sure we'll be hearing an update from that in future meetings. And lastly, the road back plan for September. As you know, on Friday, June 26th, Governor Murphy announced the New Jersey schools would reopen in fall and finally released a long-awaited guidelines by the state. At the July 2nd meeting, our district administrators shared their initial ideas relating to the the road back, restart, and recovery plan for the education from the New Jersey Department of Education. In short, recognizing that many challenges lie ahead in getting students and teachers safely back to our buildings, for the purpose of this meeting, the focus was kept strictly on instruction and schedules. The administration shared some brainstorming ideas for an alternating A group, B group approach at Ridge, which included a blend of in-person and online instruction. They shared a similar alternating A group, B group at William Annan, which included a blend of in-person and online instruction. The brainstorming schedule for the elementary school was much more complicated and included ideas for more in-person instruction. All of these schedules were a work in progress, and I believe are going to be shared out after I report out. An area of focus is the interest to find times and places to support any student from any grade level that needed additional help or support. One idea was to have half days of in-person instruction at the elementary level, but after further discussion with the administration, while they were hopeful, it is not a feasible idea to implement because A, there wouldn't be enough time to clean between the morning and the afternoon groups in the school. B, the transportation could likely be an issue as we just went to bidding on busing. And if we suddenly strayed from the bidding requirements, the district could have to go to bid again or renegotiate, which could potentially be very costly. And C, it might be even more disruptive to working parents than some of the other options that were under consideration. With whichever schedules we end up with, the administration is looking to provide support for the struggling learners and or students that need additional academic support, for example, those with 504 plans, IEPs, ELLs, as well as any other student that may need to be identified. Obviously, there needs to be a way to screen students or identify them, and the teachers and administrators are working on that now. After tonight's meeting, the next step is to share these ideas with the BT Connect Council tomorrow afternoon. And the curriculum committee will be meeting again on July 22nd to discuss final plans for bringing students back in September. Are there any questions?
So it may help board members also in terms of questions as we get through the rest of these slides. So I know we'll have plenty of opportunity for discussion as we get through them. But I think that sets the stage nicely, Ms. Richmond, for trying to elaborate a little bit, not only for board members to see some visuals relative to some of the discussion that was had in committee, but also for the public to understand what some of our ideas are. And I think it's important to kind of preface this conversation with the fact that things seem to be changing daily. We're doing the best we can to keep up with it, but there's understandably a lot going on, a lot of debate, depending on what you read when and who wrote what, you feels like you're reading opposite stories sometimes. But we're doing our best to try to come up with something that we think might be workable. And these are really ideas at this stage of the game. They're wet concrete at best, I suppose you might say. But we wanted people to understand what we were thinking. We're trying to be transparent with where our minds are, and we're trying to take into consideration all the input that we've been gathering. So with that said, there's our goal. We want to try to bring students back for as much in-school instruction that we can achieve safely. Some of the action items that we've been working on, obviously many subcommittees and committees working in district, trying to give staff and parents an opportunity to provide input and details in their surveys, having meetings like this, trying to get panelists to come on and talk about some of the issues, I think are important. And, our goal ultimately is to try to come back with something that we think is pretty solid, towards the end of the month. I know I wrote the parents a letter about this. It's a very aggressive timeline, but we're trying to give parents as well as the district staff as much time as possible to prepare for whatever the plan is. Because even once you have your basic framework, there are countless details to try to fill in all the blanks. And we also have to make sure that our plan has relevant policies and regulations created consistent with the requirements that came along when we received the road back document from the Department of Ed. These are some of the highlights from that document that I just mentioned. Conditions for learning, obviously, health and safety, SEL. How are we going to handle food service, childcare, and transportation? The planning aspect of this is clearly coming up with schedules for our students, for our buildings, for our staff. What's going to happen with athletics and co-curricular? A lot of that is governed by NJSIAA at the high school level, but certainly we have middle school athletics. We have all manner of after-school programs, clubs and activities. What's going to happen with those? We have lots of facility use by outside organizations. Is that going to continue? The list of questions is never ending. Continuity of learning, trying to meet all the special needs, ELL, trying to have technology in place to make everything accessible, trying to do enough professional learning that our staff can implement the strategies necessary to have that continuity. And of course, trying to assess students, understand where they are when they come back to school in the fall, and provide differentiation to make sure that we meet their needs and avoid compounding gaps in learning. This is a summary list of some of the big things that we've really been talking about a lot in the various schedule ideas that we come up with. Obviously, health and safety is top of mind, and then coming up with an instructional program that we think will work best for all learners. But we have learned over the last 4 months that we need to expect the unexpected. What we show you tonight could be meaningless in 2 weeks, which is a sad thought, and we certainly hope that's not the case. But we've learned that plans that we put together are nullified by a memo the next day or by an executive order. So as much as I hate to say it, I think that we all need to be prepared to continue to pivot, bob and weave. We will do the best that we can as we are asked to and as conditions change. But I think kind of the moral there is, expect the unexpected. And therefore, knowing that and knowing what we've seen in the last few months, we feel like whatever model we roll out in September should be one that is flexible so that we can respond to conditions or directives that we receive. Big issues are transportation, right? Creating social distance and transportation, managing transportation to fit whatever creative model we have in place. And obviously childcare, Mr. Syed spoke about this issue at length with respect to staff, but it's very, very clear, and we know full well that this is a major issue for everyone, right? Whether you're a teacher, a resident, doesn't matter who you are. If you have children, childcare right now is a major issue for you. And to that point, one of the things that was extremely clear in the survey, especially with respect to the open-ended items that people wrote about, was this issue of some type of schedule that could be relied on, something that was regular and consistent and would keep siblings on the same schedule so that parents would have a very solid idea from one day to the next what was going on with their children and school. And of course, in achieving whatever the plan is, we have to factor in resources, obviously time, money, personnel. You know, when we think about our personnel, we have to recognize that when we talk about different models of instruction, if a teacher is spending their whole day, Monday through Friday, working with students in person like they would normally, they can't be expected to run a virtual program at the same time. They're just not going to have the time to do two jobs, to do the regular job that they normally do with periods of instruction during the day, planning, prep, and assessment associated with those, and simultaneously be expected to run a virtual program for some fraction of the students on their roster. So that's a challenge that we're taking a look at as well, that's in that personnel resources. That is a weighty issue. So what are the possibilities? Well, we talked about that a little bit, alluded to it a little bit in the parent survey, having a 100% distance learning model. Well, we experienced a version of that in the spring. And of course, if we are continuing in that mode at any point in the future, we want to make sure we're prepared for that. So we began by reimagining that, and Ms. Fox will speak to that in a moment. And a hybrid model is another possibility where, of course, in a hybrid model, we know that we would accomplish the instruction with some in-person work and some work that occurs at the individual student's home. And then ultimately, of course, the gold standard, I think, is what we have always done in Berners Township, right? We've had our students in school, giving them a great experience, and everybody's there. I put an asterisk there because this does not fit with the guidance document that we're given by the state of New Jersey right now. If we're going to try to implement social distancing, it just doesn't fit with bringing every student back to school. The two are in direct conflict. So that's why I alluded to this in writing parents and in the survey, that we do not expect school in September to open in the normal way. We anticipate some type of schedule that facilitates a measure of social distancing, right? And that's, of course, the challenge. So I know Ms. Fox was going to jump in a little bit here to talk about what our distance learning plan might look like, different from what it looked like this past spring, with the thinking that it's important for us to have a plan ultimately in the event that something happens. And even if we start in person in September, if conditions change and we're issued an order to say, hey, you need to close down, school districts in New Jersey are going back to a distance learning platform en masse, schools are closed again, we want to make sure that we make improvement on what we experienced in the spring. So Ms. Fox, I know you want to speak to this a little bit.
Sure, thank you. You know, obviously, since this all started in March, everybody in the district, from students to teachers to staff, administrators, we've all been learning how to do school differently. It has been an exercise in professional development on a daily basis for everyone. And so that continued, right? As we went through the spring, we were learning, and we were learning how to do it better, and we were surveying parents, students, teachers about what we needed to do better. And so as we started to come toward the end of the school year, not knowing what the fall would hold and starting to think it might not be a normal return, well over 50 teachers, administrators, and staff members began to meet weekly and think about, first, how would we re-envision distance learning? So we have spent several meetings discussing just this and responding to what teachers think need to be improved and what we hear from parents in our surveys and in all of our communications, right? The ability to increase the amount of live instruction is something that we improved upon as the year went through, as the spring concluded. But we recognize that we need to create more accountability in this system to mandate students to attend classes in order to really make live instruction work. So that is really the model we've been working on, is how to build that virtually in a different way than we were able to do in the spring. That was related to whether or not students all had devices and could be mandated to attend, whether there were conflicts in the home. And so we've worked through some of those issues, and we feel that we can create a schedule for students to attend classes in a virtual scenario. Along those lines, we also spent the spring identifying our needs going forward. What would be the technology and resources we would need to acquire and learn how to use through teacher training, which is ongoing right now as we speak. And then further, you know, there are a large number of curriculum projects that I think you're well aware of, and the board, that almost every grade level is spending some time thinking about their course, and every course and every grade level. And how would this look differently in a virtual model or potentially in a hybrid model? And so we've dedicated a lot of resources this summer to making sure that we're able to meet that need should that occur.
So thank you, Ms. Fox. So hybrid learning plan, you know, what is a hybrid learning plan? We wanted to kind of give you a sense that there's basically a couple of ways to get the job done based on what we're seeing intentions look like. You know, one way is distance learning, which we talked a little bit about a moment ago. But what would distance learning look like in a situation where some kids are coming to school and perhaps some kids are not coming to school and they want to do distance learning only? So you'll see that asterisk there, and I'll speak to that in a moment. Distance learning only is students don't come to school like we had from March to June. That the conversation that we're having there is that it may be possible to match students up who are not coming to school with some teachers who are not coming to school. The teachers that are working full-time delivering in-person instruction can't be running cohorts of hundreds of students who are not coming to school in a virtual environment. But it may be that those teachers that are unable to come to school for approved reasons, as Mr. Syed described, that, you know, we need a process to establish, we may be able to match those individual teachers up to meet the needs of students that are saying that they're not coming to school. Now, where that may be impossible to cover completely, for example, a high school level student who has a series of courses that cannot be taught by teachers that are also working virtually, they may have to access content from a teacher who is working live and in person with the students coming to school. And they may be able to access that through technology. There are many opportunities to take advantage of technology that basically allow students access to the classroom from home. And this was another common comment that came up in the survey, where parents had an opportunity to respond to the open-ended item. You know, can you create that window technologically with an application, something like Zoom, or maybe something a little bit more robust designed to capture the events going on in the classroom? So it's almost like a live look into what's going on there. The blended learning situation is different, right? And so why is this whole slide about a hybrid model? Well, because some students are coming to school and some are not, right? That's what makes the model a hybrid. But for the students that are coming to school, not to be confused with the word hybrid, is the phrase blended learning, right? Blended learning has its own little definition associated with being in person in school for some of your activities and doing other learning activities at the home. So in a hybrid model, we have two ways to get the job done. One way is for the students who are completely learning from home, and the other way is for the students that are spending at least a portion of their learning time in the school in a blended learning model. So what are we thinking? What are some of our ideas? This is where you're going to see some visuals that line up with Miss Richmond's Board of Ed Curriculum Committee report. So here's an example of a visual that kind of goes along with what Miss Richmond described. Could be a possible schedule to work through for our 612 students at Ridge and Annan. Basically an alternating day model, with the idea being that you're trying to create social distancing in the school, you're trying to create space in the school. If you have a percentage of students that are not coming to the building, and the remaining students that want to come to the building are split roughly into two groups, some of the groups coming to school on Monday, the other group coming to school on Tuesday. Thursday, the first group comes back. Friday, the second group comes back. So each group coming to school in person 2 days a week. And then what happens on the fifth day of the week, right? You're trying to create equity in the amount of time that each group is coming to school. And when you have 5 days in a week, it kind of raises the question of, well, are we going to go every other week with each group getting an extra day on alternating weeks, or are we going to use Wednesdays differently? So we had a lot of conversations about that, in some ways that Wednesdays might be able to be used, given the uniqueness of the situation and the teaching model that we would be in. We have a lot of PD to do. We have a lot of planning to do. The teachers have, they're like second year teachers in a lot of ways. They're learning to do different kinds of work. In a situation like this at the 612 level, the concept is typically that a teacher would see their students on Monday, and those students are going away on Tuesday, and they are working on things at home. And those things are given to them from the day before when they were in person, generally speaking. But it could be that a teacher wants to work with their students on a daily basis, depending on the individual nature of the course, in which case we'd be back to that conversation of how do we create that technological live look-in to the classroom. And that is again with equipment such as Zoom or other devices that we could put in classrooms. How do we create the two groups? It's been a common question, the A group and the B group. We're working with our student information system provider to see what kinds of opportunities they have to help us create two schools, if you will, an A group and a B group that have the same basic makeup as the whole student body, so that our demographic makeup is consistent, the number of girls and boys. We want to keep things balanced in the same way we try to balance things when we have all the students in the school, which represents another level of challenge. Grouping the students alphabetically, A to L, M to Z, for example, may or may not achieve the type of balance that we would want to have between the A group and the B group, so to speak. We also refer to the road back document quite a bit when trying to figure out, are there special needs situations where we would want to try to bring in some students on a daily basis? This was another common survey response that we saw, folks who recognized the needs of their children, as we do as well. We may have classes of students, groups of students in self-contained type programs that are coming to school on a more frequent basis. We're not exactly sure. We're looking at Monday to Friday. Do we have enough space to do social distancing with all of these classes and bring them in every day for the day? We're taking a look at that as well. So this is a consideration for what a rotating schedule might look like at the 612 level. When the students are in school, they'd follow a regular 9-period day. And they may need to follow that when they're not in school as well, depending on how the teacher is approaching the course, and do they expect to be asking those students to quote unquote dial in, if you will, to whatever's happening in the in-person scenario.
Okay.
Yep. Oh, I'm sorry, Ms. Fox. can you jump back to that slide for just a second?
Sure.
So I just wanted to say one other thing about the A-B sequencing. So we talked a lot about this issue of should we have the A group come in 2 days in a row, and then the B group for 2 days in a row, or for those of you that pored over this document, you might have noticed that some schools or some ideas in that document were talking about A weeks and B weeks. Students in the A group coming in for a whole week, and then students in the B group coming in for a whole week. I've even heard of districts talking about doing 2 full weeks of the A group, then 2 full weeks of the B group. We considered that. Our preference at this point, we're thinking more along this line, but we had conversations about that. Next slide. Okay, so what about the blended learning model at elementary schools? K-5, we looked at a few different possibilities. Here's one possibility where students would come in every day. And again, I think Ms. Richmond reported on this concept a little bit, and we talked about the challenges of having an AM session and a PM session. So, in this scenario, rather than splitting groups of students in half by bringing in one half of the students on the first day and the second half of the students on the next day, this takes the 2 halves of students and brings in one half in the morning and the other half in the afternoon. So they're there every day, but they're there for a much shorter period of time. This model, has some advantages in the sense that, perhaps now you're not dealing with lunch and recess. You make the focus of time in school, maybe more on reading, writing, and arithmetic, if you will. And the time that the students would not be in school might be more of a virtual situation where they're working on things like specials. So that could be a model. We certainly looked at this. I know Ms. Richmond highlighted some of the challenges here. We talked a lot about this from the perspective too of the amount of moving around of students. There's a lot of humanity moving every day. And with that is a lot of transition time. And that means that 3 hours in terms of instruction isn't going to be anywhere near 3 hours at the end of the day. So this is it's got its upsides, but it's got a lot of challenges too. We're looking at the issue of the transportation model here, as Ms. Richmond mentioned. If you're adding routes in the middle of the day to take the first group home and bring in the second group, there's a significant cost there, and you have to pursue the procurement law process in even getting those routes accomplished. This model was a second possibility for K-5, very, very similar to the 6-12 model, pretty much the same type of thinking. Half the students coming in on Monday and Thursday, and the other half of the students coming in on Tuesday and Friday. And again, a question mark about how to handle Wednesdays, how to use that time on Wednesday. One of the issues that we talked about here as well, if you didn't bring students in on Wednesdays, what would that mean for your transportation contracts? Similar to the transportation contract that we talked about in the previous slide, in this scenario, we have to remember that we have contracted for busing 5 days a week. So if we go back to our transportation providers and say, well, we don't really want 5 days a week, we want 4 days a week. I think that's a challenging situation to deal with. And we could be paying for transportation on Wednesday that we're not using, which is obviously a financial inefficiency that would be a negative. But it does represent a possibility to be creative about how a day of the week is used. And as I mentioned when we talked about this at the 6-12 level, the need for staff to have a little bit more opportunity for planning and communication is significant in the way that we're dealing with a new paradigm of instruction under these models.
I would add another benefit from this model is that the K-12, all the students would be on the same schedule, which
Right.
is sort of the reason for this possibility.
Right. So if we match this up to the 612 slide that we showed you, it would put everybody on the same schedule, which was a very, very vocal theme in the open-ended responses of the survey. And similarly, we talked about trying to have additional time for some of our self-contained programs to be coming in daily. And again, looking at the capacity to do that. Same challenge there in dividing up the students into the A group and B group, trying to find the right way of doing that to keep things balanced. So this third possibility for K-5 kind of represents an opportunity to reduce the overall amount of time that the students are in school, recognizing the challenge that may exist for elementary students especially to be able to adhere to whatever our mitigation strategies for health are. You know, whether it's wearing a mask, whether it's staying apart from your classmates, whether it's eating in school. There's a lot of challenges that go along with all the mitigation strategies that we're looking to try to put in place. And that could be, I think we all recognize, more challenging for younger students. And this concept basically takes the previous slide and suggests that time is adjusted in some fashion to get students out of school a little bit earlier. You know, what does that mean exactly? Well, roughly speaking, if you think about the way transportation works in our district right now, we dismiss the elementary schools after the high school and the middle school. That's the current status quo. If you flip that and you had the elementary school students taken home in the afternoon prior to the dismissal of Ridge and Annan, that would push back maybe about 2 hours the amount of time that the elementary school students would be in school. So maybe they're at school 4 hours and 15 minutes, something along those lines. And you're making adjustments to what content is taught in person and live and what content might be taught virtually because they're not in school for as much time. But you may be able to minimize some of the strain on those elementary school students without going so far as to reduce to 3 hours a day.
Okay.
Okay. So some of the other areas of work, and obviously this is not a comprehensive list compared to the number of issues that come to mind as we work through this, but there's some of the big areas. We don't want people to think that we aren't thinking about SEL because we focus mainly here on a variety of schedules that we were considering. Certainly this is an area that we're trying to work into whatever schedules we choose. The second bullet point there is about the beginning of the year and building a community of learners. That virtual / in-person parentheses is an emphasis on the notion that the first week to 2 weeks of school might look a little bit unique from the perspective of what we're training the students to do, right? Training the students how to operate in a new paradigm, just from a behavioral standpoint, how we move through halls, how we move in and out of the school, whether or not we're doing temperature screenings in person at the school, all of those types of things. Plus, you know, trying to prepare for what may or may not happen in the future if schools were closed again, training the students about what they need to learn first if in the event all students have to go back home and learn remotely. So training students on those skills, creating more email accounts for younger students, for example, training them to use things like Google Calendar, those types of things. Obviously, the before and after care program is a huge question mark, along with a lot of our other programs that run in our buildings. Our co-curricular, our athletics was a common question that we saw in the survey. Will before and after care programs be running? we're working on trying to figure out the answer to that question. We need to talk to our staff. Are our staff willing to run a program and spend extra time after school with students? How much are their own childcare issues going to impact running a before and after care program and having the staff? We recognize that this is a big question mark. We're trying to figure out the answer to this. And also the question mark of whether or not childcare would occur on days that a student is not scheduled to be in person. And candidly, when you think about that, if you are, say, an A-day student, on the B day, when you're working from home, can you come to school on your B day and get childcare all day long? That's a monumental ask, given the fact that all the staff are going to be working with the students that are there in person and using all the classrooms and extra spaces that we have. I just don't conceive of how that could happen to simultaneously run a daycare program during the school day. NJSIAA, as I mentioned, is really the kind of the decision-making body with respect to how high school athletics would run. We need to take a look at VOTEC, match that up with whatever schedules we're doing, especially the part-time VOTEC students. Obviously, full-time VOTEC students, they can follow whatever the VOTEC program schedule turns out to be. But if you're part-time, we have to try to figure out how to dovetail with what the VOTEC is doing. And we need to work on policy and regulation, not only the road back requirements, but our own local policies and expectations about things like attendance and grading and academic integrity, which we certainly recognize as an issue when students are working remotely. So thank you for your attention. Thanks, Ms. Fox, for emceeing the slides there. Okay, so.
Mr. Markarian,
Yes.
we have about 50 public comments.
Okay.
So, Ms. Fox, are they all 50 or some of them?
I'm sorry, I didn't hear your question. Broke up a little.
That's okay. I was asking, are they all very lengthy? Are some of them brief? Are any of them common in theme?
There's some of both. I mean, there are a lot of common themes. Some of them are lengthy and some of them are short. There are a lot of common themes.
If I may, Mr. Crute, are you there?
I am.
So is there any direction or advice you can give the board? I've been watching the public on the second screen, and they are dropping off, in tens as we go here. So I don't know if we'll even get them all read in before we lose our audience, but any advice would be appreciated.
Sure. Let me just say, first of all, that under both board policy and the law, you have the freedom to set the amount of time that you're going to take public comment during the meeting. You've already had some public comment during this meeting. All the law requires is that we have an opportunity for public comment. The length of that public comment session and how you do it is up to the board. So given the hour and the fact that a lot of people are leaving the meeting, if you wanted to, you could certainly have all the comments read into the record. You do have a restriction of 3 minutes of comment. I think one reasonable way to handle it would be to allow for a certain period of time. Say that we're going to now accept public comment for X number of minutes, read as many comments as you can in that time, and then close the public comment session. That, I think, would be a reasonable way to handle it, to be fair.
Okay, so I don't want to overstate the departure. We still have 382 people watching. So there's a lot of people out there. So I think that we owe it to the public to try to read in a period of time of public comment. Do board members have any suggestion on, how many minutes should we try to hear public comment for? And we'll will test Ms. Fox's speed reading capabilities. Any thoughts or suggestions, anyone? Oh, come on, guys, don't make me do it by myself.
Karen, this is Tim.
But I can remember from when
Oh.
this happened in the past when we had like a really huge attendance at meetings. We just allowed like a half hour or something. But we have, I think a lot of these comments are going to be ones that are questions.
Yeah.
And so, I mean, I think the idea that Mr. Markarian said before about having an FAQ or
Well, I think we've already agreed to
document.
do that. I think we just need to
I
say.
think we should make sure that the public knows that we're going to post the comments, even if we don't read theirs, and try to answer them.
And Mr. Salmon, you were going to say?
Yeah, I was going to agree with Robin, because I think the other thing is, Nick, are you prepared to answer this 30-minute stretch of whatever X minute stretch of public comment, or are we just reading this into the record verbatim and then we'll get to it later? What's the plan for responding to public comment?
Well, typically what we do is we listen to the public comment and try to respond in as much summary fashion as possible. So, I mean, I think if you want to set a time, I can respond as much as I can in summary fashion, and then try to handle the rest through an FAQ approach.
Yeah, I think we're going to be here for another hour reading public comment and having, responses to every various public comments. So the FAQ approach sounds good to me. Also, we do have Jerry Ford, who's been sitting here, patiently, and it'd be a good idea to get some summary of what he's seeing in the busing world, maybe before we get public comments. So, maybe we can release him back into the wild.
Is everybody okay with that? I think that's a great suggestion.
So do you want to set a time limit then on getting what we can done, or do you want us to try to turn all the public comments into an FAQ?
No, I think let's hear. I think the suggestion of hearing some now and then. What did you say, Karen? 30 minutes? Is that what you had said?
That was what Robin suggested.
Robin said, and then beyond that, put the others into FAQ. So everybody does have the opportunity, but at least we can, hear initially.
I would add to that. I do like Tim's suggestion though about having an opportunity for Mr. Ford to say a few things, because transportation is so significant in all of this. Ms. Schaefer?
Do you want to do a split? Because if we do 30 minutes of questions and answers and then Nick responds to everything, it's still going to be another hour. So do we do 20 and 10 minutes of response so that it's at least a cutoff at that point too?
Do we have to take a vote to have?
I think we have to make the decision, because we're just letting time go by. So
yeah. So here's my suggestion. What I suggest you do is let Ms. Fox do what she can with some of the public comments for about 15 minutes. And I think if she sees that one comment is one that she's already read into the record, to move to the next one and try to get the new ideas read out. We can forego a response to them. I can do a Q&A. If you want to let Mr. Ford kind of weigh in on some of what he might have heard come up as transportation questions first, and then dive into public comment, I think that's perfectly reasonable.
I think we should proceed with that.
Okay.
I'm seeing a lot of nodding.
Okay. So I would just start kind of with chronologically and work through, and I'll do what I can to eliminate.
I think the idea was to go with Mr. Ford first.
Right.
Okay.
Let's let Mr. Ford go first.
Good idea.
So, Mr. Ford, I appreciate your hanging in there. I know I asked you to be available because I knew some transportation items were going to be addressed as we spoke through some of the slides tonight. And I think that at this point, perhaps, if any board members heard something that they want to kind of get your take on with respect to transportation, maybe you could share a little bit of your thoughts on any specific questions that they have first. And then if they have none, maybe you could just address the issue of adding transportation or subtracting transportation from our recent bid. Does anybody have anything kind of specific they'd like to ask Mr. Ford?
Mr. Salmon?
Hey, Jerry, this is Tim. So you saw the schedules that we might implement. Nothing looks like the normal school schedule. So where does that leave us now that we've gone to contract with these bus companies for specific routes for specific students? How do we troubleshoot this in that there's going to be A days, B days, or whatever mix of routes and students might be on these new bus routes?
Right. The actual stops won't fluctuate. The routes themselves will be pretty consistent. If we go to the AB day, then obviously we'll be picking up A students on one day and B students on another day. So we won't be making all the stops, which means it's consistency for the drivers, and it should be consistency for the students as well. So I don't see a large problem there. If we're not doing Wednesdays, we have a per diem contract for the contractors. And perhaps we won't get charged for those days, or we'll negotiate something with them. Mr. Marcayan and Mr. McLaughlin have been touching base with me as these plans go through, and we're having discussions on a almost daily basis to make sure that transportation can flex with what's going on. And I don't see any major problems. The biggest thing we'd have to do is, if we did the 3-hour session, we would probably have to go out to bid for that middle route. It would be an additional cost as opposed to the other plans. But the only other consideration is social distancing on the bus is looking less and less like it's a probability. We'll have to go to masks. The CDC guidelines and the state guidelines put about 11 kids on a 54-passenger bus to be completely social distances, and that's just highly impractical. No one has the resources for additional buses or additional drivers, and of course additional cost is not a good thing. So
one follow-up question. Let's say we were going to run half days. Does that, but same routes and everything, but it's a half day of school, for example, at the elementary, like an early dismissal day. How does that impact our contract with the bus providers? Is it the same?
It doesn't. We just shift the time, the elementary dismissals, which are after the William Manning and high school, to before, which gives the elementaries a shorter day as was proposed. But with the contractors, that's usually not a problem at all. They're still doing the same amount of driving, same amount of hours, so on and so forth.
And when you said the middle route, this is my last question. When you said the middle route, it was the, in the AM PM session, it's like the pickup from school with the AM kids and then the drop off with the PM kids. That's the middle route that you're talking about?
Yes, actually what we would probably do is pick up the students at school, half day, midday. As we're dropping them off, we'll also pick up the other students that would then get dropped off at school. That would minimize the time in between. And again, the only problem with that is how many students you're going to have on a bus. The first consideration obviously is the educational portion. The second consideration would be a geographic based, so that the buses don't get overloaded.
Thanks, Jerry.
Okay, thank you.
I see Ms. Korn's hand.
I just have a quick question about the bus drivers. Is there any indication that the bus drivers, we're not gonna have enough bus drivers to drive because they're too afraid to come back and drive kids, or if there's gonna be more than the socially distanced kids? I get everyone's gonna wear a mask because that's the rule now, which is fine, but I don't know if you have an indication, or if the drivers are the same as that the teachers. I can't remember the name of the where they get the 12 weeks, if they have some kind of childcare, or I'm just asking the question because we seem to have drivers are always an issue anyway. So
yes, they are. Actually, most drivers don't work enough hours to qualify for FMLA. And those that do, they may take it, they may not. The staff concerns from the drivers are going to be similar to your staff concerns. We're always in a shortage. We managed to make do. The contractors have to get aggressive in looking for more drivers. And we've had sort of a contract shift. One of our contractors both contractors were doing numerous buses for Bridgewater Raritan. Neither of them are working for Bridgewater Raritan next year, so they're sort of shifting over to Bernard's. So one hopes that they retain their drivers and they'd be fully staffed. The health issues are a whole other issue.
Mrs. Wooldridge.
Yeah, hi.
Hi.
I know that masks will be required on the school bus, but I'm a little concerned about students like taking them off during the bus ride. They may fool around. I mean, they're kids. So is there any thought gone into that? I mean, I know could be a big issue.
Hopefully the school will develop a practice of what they want the drivers to do with children on the bus. Become a disciplinary measure, just like many other disciplinary measures that drivers can take care of on the bus. They see a student without a mask on, they'll first ask them to put it on. Usually they'll comply. Some students will forget and take it off again. And then eventually we'll have guidelines where the drivers will report that to the school, and the school will then counsel the student and perhaps get the parents involved.
Okay.
Anyone else? I'm not, yeah, I guess I can see all the board members on my screen. I don't see any other questions from board members. So unless I'm missing somebody, speak now. Then I guess we'll move on to 15 minutes of public comment from Ms. Fox.
Thank you.
Thank you, Mr. Ford.
Thank you, Mr. Ford. We appreciate your time.
Okay, I will, group them together where I can, where there are some repeated comments, and then read some of the ones that are more specific. There are a number of comments where parents are asking for an increase in live instruction, compared to what we were offering in the spring. So there are several of those comments. There are several comments asking for an option to be completely virtual for students who don't want to come to school. We did address that. There are a series of questions really procedural. Like and I think we addressed quite a few of them, but not really medical, but what are we going to do if a child has a fever? So we talked about a lot of those things. What about a 14-day quarantine, if someone in a family is sick? So there are quite a few of those questions that we could probably put in a Q&A. And then, so here's one that I was going to read. There was a group of 23 parents who signed a letter and sent it in with some recommendations for how to improve instruction, whether it is 100% virtual or a hybrid. And they're from William Annan, and they all signed it. So there are 4 things that they list. 1, Chromebooks, distribute Chromebooks by August. 2, teachers should have all Zoom sessions live, as they would have with an in-person class. They can use videos for demonstrating concepts, but also to have 15-minute breaks in between classes. Home assignments, they ask about distributing online and offline modes so they can reduce excessive screen time, which is an important discussion we've been having. And number 4, they ask for the communication about dates and reference materials should be given well in advance at the beginning of each month at least to reduce stress on the students and help them plan their study schedules in advance. So this is a parent, Mark Johnson, 76 Vanderveer Drive in Basking Ridge. Based on your survey results for Mount Prospect, are you taking into account the amount of parents that stated they would not be returning their children to school? You have no reference to the number of students per class in your plan you have outlined. The numbers for Mount Prospect should work with students full-time based on the numbers of students returning. So sort of specific to the results of the survey. So Kathleen Healy, 284 South Maple Ave in Basking Ridge. I think this is kind of similar, but it says, I would like to understand how the different ages and learning styles for children will be taken into account in determining the return to school schedule. As a parent of a rising 4th grader, due to her own initiative, given her 2 working parent schedules, fared reasonably well in distance learning, but did not find that much new material was covered. So she goes on to talk about how we can increase the amount of instruction that the students at the elementary are receiving. So she mentioned, I was encouraged to see that the Chatham school plan hopes to include 5 days of in-person learning with early dismissal, allowing for live streaming of instruction to students who choose to continue remotely. This technology plan also allows for the option of pivoting if the schools again need to go into full distance learning, enabling students to have the highest quality education. Questions about air quality, taking steps to improve air quality in the school buildings to reduce the chance of submission. I would like to ensure that students' personal health information would be kept confidential and protected. How will this be done? Will you be restricting and limiting eating to just once at lunch during the day, since that will help minimize the chance of transmission? There was a student comment with no address given, but really just talked about the difficulties with returning to school and some fears. Has there been any discussion about holding some classes outside while weather permits? That was Lisa Marshall, 1 Edward Court in Basking Ridge. So a question about whether this is Arturo H. Benegas Macia, 75 Landau Road. Whether the recommendations are unanimously supported or if there is any advisor with a different approach or position, speaking to the panel. See if there's a name here. So Lauren Manduk, 46 Liberty Corner, asked, are desk barriers being considered by the district? Asked why we didn't have mental health experts on the panel. Asked if we can take away recess, like if it's against the law to take away recess as punishment, why is this contemplated here? Is a person with a medical condition or special education needs be isolated, removed, or put behind a barrier if a mask isn't an option? And then number 5, for children with speech issues or in reading support who need to see a teacher's mouth and have their mouths seen, what is an option for them? A question about thermal scanners. Jamie Dweck, 5 Joanna Court, said there are thermal scanners that can be bought and take about 2 seconds per person, decreases individual contact. If they have a temperature, then the adult is sent home. Deborah Nod, 11 Atlas Road, Basking Ridge. Not so much a public comment, but wondering, for high school with the 5 absences and fail a course for marking period rule, I believe mandated by the state, will this be revised? Gudia Singh, 154 Deer Ridge Road. Question regarding the second wave hitting us in the fall. Will the schools be equipped to have more consistent virtual instruction at all grade levels? In general, parents struggled with keeping kids at home and working on school while also working. So, looking for a name. Lisa Ellen, 1 Pheasant Run Drive. When talking about accountability and parental responsibility, parents need to keep students home if they have a fever or are sick, But the district also needs to consider changing absentee policies and also policies about making up work to alleviate the stress and pressure to be in school, especially at the high school level. Also, as for wearing masks in school, it's hard to do that for hours on end. People need to have a break from mask wearing. Another question about masks. Here's a comment about some of the models we presented. So James Volpel, 20 Evergreen Place. Good evening, members of the Board of Ed. I am very concerned with any schedule that involves using AM and PM sessions. In your proposed K-5 blended model, you allow for 1 hour for cleaning between sessions. It is my belief that 1 hour is not enough time to thoroughly clean all school surfaces before the PM session arrives. Also, it is my understanding that the state requirement is 4.5 hours to count as a school day, utilizing a half-day schedule. Did the state relax that requirement? I've seen many children walking and playing without masks and not being socially distant this summer. What precautions will the district take to promote, enforce social distancing upon arrival, dismissal, to and from school? Sherry Nelson, 195 Smoke Rise Road. What consideration is being given to the mental health of our students? How do they have a positive social emotional learning experience when being told that they are to treat each other as if they are all contagious with a deadly disease? Sharon Maloney asked of 26 Alder Lane. Asked a few questions. Have you looked into any of the European models for attending school? There are some countries that have never closed and appear to be fine. So several comments with parents with specific health issues of their child and wanting to know how that will be accommodated. Specific needs. Sundar Krishnan, 6 Kensington Road. Do you communicate to parents about the school sanitation process? How frequently school hallways, tables, buses, restrooms will be sanitized? Do you keep sanitizer stations? Heather to 461 Northbrook Ave, will there be before or after care? And also, how often should I replace my mask? Satish Tadavarti, 6 Austin Drive, Basking Ridge. Can parents be given a chance to visit schools to get a firsthand view of safety precautions being taken before sending our children to school? Several comments concerning about an increase, in the spread of the disease and worried about returning to school at all. Jamie Morris Dweck, I think I read a comment of hers before. She sent, I think, a summary email. 1, temperature checks at school. I believe it's important to check temperatures daily, and that should be done at school. 2, what should be done when a student or staff member has a positive test? CDC and the local hospitals have already outlined what should be done. There are several scenarios that are reviewed in regards to quarantine or not. I should review those. One parent, Dawn Simone, 4 High Hill Court. Whatever plans are made, I'm hopeful that some option for parents to keep their child home would be feasible. And then number 2, are you looking for more people to be substitute teachers? If so, what is the process for being hired? Stacy Letty, 67 Spencer Road. Why is it that the Chatham School District has managed to come up with a plan with students going 5 days a week? Why can't we do the same thing? And Andra Schwab, 26 Coppergate Drive. How will the school handle a child falling behind due to internet connectivity issues during live instruction or when completing work toward a deadline? Don Simone, 4 High Hill Court. For middle and high school, consider moving the all virtual day to Friday. Would allow for 3-day weekends and make it a makeup day for students. Gina Foster, 17 William Street. Thank you for this informative presentation. One option considered by some other school districts has been to allow older students, for example, grades 9 through 12, who are capable of staying at home alone to continue with distance learning. This would then free up building space for more of the younger children who cannot stay at home to attend school in person 5 days per week while maintaining adequate social distance. The benefit of this approach would be that it would enable more working parents to consistently return to work while minimizing exposure to additional caregivers who may otherwise be required to watch children of working parents and thereby further increase the risk of COVID-19 exposure. Elaine Daddario, 46 Dykeman Place. Please explain what the nature of the anti-racism curriculum will be and what are we hoping to teach our students specifically? 2, with an asthmatic student, the New Jersey law, Governor Murphy comments pertaining to medical conditions and HIPAA laws, one is not allowed to ask for proof of medical conditions. Please explain how the district is overriding the laws with asking for a waiver or medical notes for these conditions regarding use of masks. Attendance, how is this going to be managed under the in-person, hybrid, or distance learning scenarios? As a suggestion, you might consider only having to indicate absences and not having to log in presence attendance each day.
Excuse me, Ms. Fox, I think it's been about 15 minutes.
Okay. Did get through most of them.
So, Ms. Gray, I could tick off a few things if you want in a few minutes, a few that I should probably respond to if you don't mind.
Absolutely.
Thank you. So one issue, a lot of the questions relate to school policy and setting policy. Part of the road back requirement is to set a policy and regulation with a plan that answers some of those more detailed questions. What is, for example, exactly what is the district's plan if someone tests positive, right? So that has to be written out and put into the plan. So in a Q&A, some of the answers to these items would be, that the answer to that question will be in the final plan that is required to be produced in Board of Ed policy and regulation. So we have to work through those things. It'll take some time to check all those boxes. And one of the other things that I meant to mention when I was going through some of the slides is the issue of the virtual home learning. Everyone who wants to exercise this idea of, I want to keep my child home and I don't want to send them to school at all. I want a virtual learning. And I just wanted to remind people that in order for us to be allowed to do that, we had to have special dispensation from the state to count those days towards the 180 days this past spring. So as a point of clarification, one of the reasons that I wasn't asking for people's commitment one way or another to distance learning versus coming to school when I did the survey is because I'm kind of waiting for the clarification that goes along with kind of a law question about, well, how is the state going to make a provision for us to be able to count that time if students are not coming to school and are trying to earn credit? It was addressed somewhat in the road back, and certainly there was a lot of positive language in there that has me feeling as though it's not going to be an issue, but it is a point of clarification that we want to get that speaks to a matter of, state statute talking about students that have to attend school as part of the compulsory education law, ages 6 to 16. You have to attend school. You have to have 180 days of school. One of the public comments addressed the point about for a day of school to count towards the 180 days of school, you need to have 4 hours of instruction. Does that 4 hours of instruction have to be in-person instruction? Or could it be a combination of time in school and a time out of school? So there are New Jersey statutes that speak to this, several of these subtleties in the law, and I anticipate that there will be clarification associated with some of the language in this document that suggests that these virtual and hybrid programs are the way to go. So it's an important point to just kind of footnote that ultimately we need to have that clarification, and ultimately our plans need to be approved going forward, not only by our board, also by the state, the county superintendents. We want to make sure that everything is copacetic, and a lot of these policies and regulations have to be kind of held up in light against statute to make sure that everything is in order. The Strauss Esme law firm that the Board of Education uses to help vet and write policies for the board is aware of this, is aware of the road back document, is aware of the state requirement to pass policy associated with a lot of these things, and they are in the process of drafting a policy for the Board of Education to work through so that we meet the requirements and we're sensitive to our existing statutes and codes as well. Thank you for allowing me to add that.
Thank you, Mr. Markarian. Do board members, I think at this point in the agenda, we're up to board forum. Mr. Markarian, was there anything else that you wanted to say before we move to board forum? I know we have some new folks on this evening's Zoom call.
Well, I did mention at the beginning of the call, at the beginning of the meeting, I know it seems like a long time ago, struggling to get the technology working, but on my screen, to my left is Holly Foley. I mentioned that she's our new principal for Oak Street School and overlapping for the summer, transitioning with the outgoing principal, Ms. Costa, who is also on the call listening, I'm sure. And directly below me in Hollywood Squares is Mr. Russell Lazovic. He is our new high school principal. He has he's diving into the workload. And of course, top of his list is trying to make sure that he has a solid plan for the July 15th graduation. So I apologize for handing you that as you step through the door, Mr. Lazovic, but I appreciate your professionalism in working so hard on it. I know that he is diligently working with not only Rita and Hank Werner to make sure that our plans are, good with the police and good with the health department, but he's also working with his administrative team and transitioning with Mrs. Hudak to really put together what looks to be a very good plan for graduation on July 15th. And I've kind of given him these duties. I know he wants to send out a letter and say hi to the community as well. And if you want, Mr. Lazovic, feel free to say a few words now, or Miss Foley, but I don't know how well that's going to go over at 10:33. Maybe you better just send your letter.
Okay, well, thank you for that, Mr. Markarian. And a warm Berners Township welcome to this really fantastic, 3.5-hour meeting, Russ and Holly. Board members, we're up to board forum. Any comments, questions that you want to add at this point? Mr. Salmon?
So thanks everybody for putting together the information and for going over the survey results. I think, one of the other points that some of the questions were, what if I want to keep my child home from school and, or I want them to do distance learning 100% of the time. I think the district's plan has to account for that student potentially coming to school at some point. So there's no, like Nick said at the very beginning, this wasn't like a contract. Parents weren't signing anything. It was just a survey to take everybody's temperature. That's a phrase that now, but so just understand where everybody's at. So like the plan has to accommodate potentially 100% enrollment, right? So like everybody in the district sending their students to school. So just I'm coming back to the elementary part of the schedule. So it sounds like the split session AM PM is not going to be workable because of the going out to bid for, now I understand it's going out to bid for that middle route that's running kids back and forth in the AM PM. And then 1 hour might not be enough time to thoroughly clean every classroom to have new kids in the building. I'm still kind of coming back to the point that, for like K1, 2, 3, it's so fundamental that these kids are in school and getting instruction. And I think that, having kindergartners or first graders, second graders, third graders, whatever, sit all day in the same room with a mask on, I just think it's a lot to expect for those kids. So in thinking about the split session, the other thing I was thinking about was, could we potentially do something at the elementary schools where it's like the K through 3 go Monday, Wednesday, Friday, sort of like half days, or like modified half days, so that it's equitable time, so that the 3 half days equal 2 full days in school, and then 4th and 5th grade go Tuesday, Thursday, full days. So what I'm looking for is at the elementary level, especially for the early kids, is consistency, live instruction, and more physical face time with teachers, but in a spaced out fashion, like less, because I don't know if anybody else, like what masks everybody else is wearing these days, but like, I was in a mask for about an hour yesterday and I thought I was going to pass out. So like for the little kids to sit in the masks all day, I think that's going to be pretty tough. And, I understand the struggles that the teachers are going to have. Like there was a question about, Linda asked about Jerry about compliance with masks on buses. And I think, the teachers are going to have that issue too, especially for the younger kids. So I think getting them into a routine, with more kind of come to school, be with your teacher, be with your classmates, get into that routine can help, assimilate everybody to the new normal guidelines that we're going to have. So I don't know if that's a possibility, to get, whether it's K through 3 or K through 2 even. I guess I would, try to get as many kids in as possible. The second part of that is, you do read about what other districts are doing, and Chatham is doing that. So maybe Nick, I don't know if you have any inside baseball on that, but Chatham is at least publicizing that they're doing every elementary kid in for half days. So I don't know how they're accommodating that. Maybe they're just saying everybody wear masks and, it's regular school. And we're just limiting the time, and that's the only way we're limiting exposure. But those are two things I was thinking. So for the early grades, doing something more like a split schedule of, Monday, Wednesday, Friday, modified half days, and then 4th and 5th grade, full days on Tuesday and Thursday. And then, does anybody have an insight into what Chatham's doing and how they're pulling it off?
Mrs. Beckman?
I just have a comment about the teachers wearing masks. So I have a hard time, and maybe it's just me, but I have a hard time hearing people when they're speaking under a mask. And maybe it would be helpful for the teachers maybe to try to work with other teachers to see if they can hear what they're saying when they're teaching for a half a day to these kids with a mask on. Whether they can either amplify their voice somehow with a speaker, or maybe it's just me and maybe they can hear, but I think that would be something that they should do ahead of time so that when school starts, they know whether the kids can even hear them or not.
Ms. Schaefer?
Can I ask a clarifying question, Nick? You had said something about the students, that we need to get permission from the state for all these policy exceptions, including attendance and things like that. And I thought I heard you say something about the kids who would want to be or have to be virtual, we have to get permission for that. Can you clarify that? I mean, is there just currently a plan that we've got in place, or the thought is that this blended plan is for the 80% of kids who are going to be there and the 20% who are not can be in virtual classes on a different type of schedule and things like that? Or are we going to have to find out if that's even okay?
I'm just waiting to find out if you want to finish finish your board member comments, or you want me to answer questions one at a time? Because Tim had a question.
I have a question.
I can do them one at a time. It's probably easier if that's okay. So going back to Tim's question about Chatham, my understanding in reading probably similar news articles that you read about Chatham is that it sounds like their intent for one of their options, and they had multiple options, was this idea that bring kids back, bring kids back to school. I believe I read that they did a survey, a barometer check, if you will, and they had like a 90% response rate for wanting to come back. And so the concept there, I think, was to bring students back and mask up, recognize that classes are you're not going to have social distancing in the classes, not by a long shot, not if 90% of the kids are coming back, and put on a mask, see what happens, I guess. It's not something that is banned from what I'm reading in the road back, but it also, to me, doesn't really fit with social distancing. So, it's a strategy. If you read the document, it does say that if you're going to have students coming in and you're going to be less than 6 feet apart, then you should wear masks and mitigate with barriers. Is that an option? I wouldn't say it's an illegal choice, but my reading of this guidance document and gauging the sentiment that I'm seeing from the survey is that we don't have a preponderance of that desire from what I see in the survey. Even in the open-ended responses, yes, we had people indicate that that's something that they're thinking is a good idea, but out of thousands of open-ended responses, we had less than 100 that expressed that in any kind of vocal way in the open-ended response. So while that may be what Chatham's doing, it's not something that I see a strong support for necessarily in our district. And the one thing that we see throughout all of these planning efforts is to work with your local boards, work with your local community, and try to put together a plan that works for your community. You know, the question of, well, how are they doing that? Well, I guess they're choosing to do that. That's how they're doing it. Let's see. The other question Suzanne asked was, I'm sorry, Suzanne, what was your question again, real quick?
About the kids who want to be distance.
Yeah, the distance learning situation. Right. I'm just trying to make the point that I fully expect that it's not going to be an issue, but it is something that I'd like to get in writing. You know, if you'll remember, there have been times that the Department of Education has issued plans or memos or letters that later people questioned, well, is that legal? And then it sometimes created debates, right? And so, you know, even looking back to this past spring, you know, was it legal? Well, yeah, they made it legal, right? We got special permission to run schools remotely because of a pandemic, right? Now we're in a different mode. In the fall, we're being told to open in some capacity. So now it's slightly different situation. We were told we had to close in the spring. Now we're being told we have to open in some capacity. So the dispensation that we had in the spring is now a separate scenario because we're not being told to close anymore. We're being told to open in some capacity. So therefore, I just want to make sure that the language in here has a clarification that gives us cover if anybody turns around and says, well, wait a minute, does that count? Is doing that count? Certainly, the guidance document we received gives us support for it, so I'm not overly concerned about it, but it is something that I am chasing down clarification for.
My camera.
Mrs. White.
I'm not that concerned with what Chatham's doing, mostly because I think what they're doing and what they end up doing are not necessarily the same thing. On the news today, they said shortly before we had our meeting that next week we're going to be getting new guidelines. So the reality is, whatever we've discussed tonight and plans we've made, next week could be moot when we get new guidelines. So I think we kind of have to not worry about so much what other people are doing and just stick with our plan of, you know, as we get new information, we adjust and we adapt. But Nick, could you just, because I don't know how many parents are still on, but it might be helpful for them to know the timeline in terms of, like, tomorrow we have a BT Connect meeting, and then
Right, sure. So right, and you know, to be fair too to Chatham, I read the letter the superintendent wrote, and he's very clear that, you know, all of these plans need to be vetted, need to be approved, and things could change, right? So I think all of us as school administrators and superintendents recognize what you just described, right? As far as our timeline here, the goal for tonight was really to try to get some more community input, to be transparent about what we're thinking, to share with the community what we see them telling us about what they're thinking, and to start the conversation and make sure everybody has some sense of the ideas that we have to try to make something work that's sensitive to the fact that there are people that really don't want to send their kids to school right now based on what they're seeing, and there are people that do. And we are given a directive that says you must open schools in some capacity. So we're trying to work through all of those things, and you know, obviously communication is a big part of that. So to your point, Jen, you know, we had this board meeting tonight, tried to have some panelists to talk about some of the health issues, tried to give the community some sense of where we are with feedback on surveys and where we are with some of our ideas about trying to put together a schedule that would work, right? Tomorrow, we're going to try to have a slightly more intimate setting of a small group of parent stakeholders in a BT Connect Communication Council meeting. And that's right up this alley, right? The purpose of that BT Connect Communication Council meeting is is to talk about our curricular programs, issues in the district, our strategic plan efforts. That committee represents leadership from all of our PTOs, leadership from the PEC. We have a large group of parents on that committee. We're trying to work quickly. We're trying to be nimble. We're not trying to reinvent groups of people to have a conversation where we have a group of people that's perfect for having the conversation. So we're taking advantage of that structure. We have staff members on that committee. We have some students on that committee. We have some board members on that committee. We're inviting Rita Zarabera on the committee. So we're really trying to be representative. So that meeting's going to happen tomorrow. I think it'll be a great opportunity to debrief some of what we shared tonight and get some more input. We're going to take that input. We're going to keep working. Next week, we have an administrative workshop that we do every summer for 3 days. And we're basically going to batten down the hatches and try to take all the input that we've gotten from stakeholders and from board members and see, if we can't start to move some of these ideas into something that's a real recommendation and is firm. And we're going to work at that next week. The following week is Monday. That was our goal, to present something solid and see if we have support to move forward with that from the board's perspective, to start filling in all the blanks, because obviously we need to pick something to share with the board, to get the board support to share with the community and say, okay, now we got to start filling in the blanks. All the little details that go along with trying to make this thing happen, whatever this thing is, right? So that's why the timeline is aggressive, because the amount of work and energy and time it's going to take to start to try to reinvent school for September is astronomical. It's just astronomical. You think about it and you realize you've only thought of the tip of the iceberg, and then you realize it just keeps going down under the water as you try to implement whatever you're doing. So that's why we're trying to move it along, and so that's the goal for July 20th. And we'll circle back with board members and community members along the way, and try to keep dealing with the all the issues that are going to come up with changing everything around. We're just changing it all around, and we're doing that because we're trying to make social distancing measures have an opportunity to work. And we don't see how we can give social distancing a chance if all the kids are in the schools at the same time. It's going to be hard as heck to even do it with 40% of kids in a building at once.
So we still have almost 250 people, and I just want to make a comment. I hear Mr. Salmon loud and clear about our K1, 2, and I guess 3 students in terms of the importance of them being physically present. And I know Mr. Markarian can attest to the fact this is a conversation I had with him offline last week. But one thing that concerns me, there's a lot of creative ideas, and I think we could probably all agree, whatever we are, 270 people here tonight, right now, that there's not one perfect plan that's going to suit everyone's needs. And what I'm concerned about is that the more ideas there are, the more, the less ability we have to hone in, to Mr. Markarian's point, on something that we have to approve and then announce to the community as the plan no later than 30 days prior to our start of school. And there's a tremendous amount of work that goes into the plan, but then there's work that needs to be done to actually bring the plan to fruition. So I love what you said, Tim. I think it sounds great, but one of the messages that came through loud and clear in the survey was families want their children to go to school on the same day. And if you have a 2nd grader and a 5th grader, it's going to be hard to go to school on the same day if the younger ones are going Monday, Wednesday, Friday, and the older ones are going Tuesday, Thursday. So I think we still have to keep in mind that the community needs some sort of schedule and consistency so that they can plan for work and childcare. And if you have family members or out of town relatives or friends who are going to help you out with childcare, there's got to be a way to know when those days are. And if it's all week, because most people aren't leaving their 4th or 5th graders home alone all day, that's a challenge. So I'm with you on the what you're striving for, but I think we've got to come up with something that will work within what the community's asking for.
Yeah, sibling consistency, I think, is going to be a really heavy lift, because let's say you have a 9th grader, a 6th grader, and a 4th grader. How are you working that out? I mean, you're going to sync all their schedules from Ridge to Annan to.
Well, I think we've agreed that we're going to have an A group and a B group. However, those are defined. Address is going to be part of that.
Well, that's one thing that we discussed in the curriculum committee, was how to define those groups, and there was a recommend, and somebody was saying that maybe it should be grades and not, siblings potentially. So, to keep kids with their friends.
We run into a problem with grades, though, because you can't bring the whole 9th grade to school because they all take classes together. You need twice as many staff members then to divide them for social distancing.
You're already dividing them.
Pardon?
Aren't you already dividing them into A and B? What do you mean?
Oh, you're saying in lieu of.
Like, no, I'm just saying half and half. I mean, that's what it is. It's half the school, and it doesn't matter whether you divide it up by, it's arbitrary, right? So it's like any half and any half. So if you're right, but
what I'm saying is that 9th graders go to class in a classroom of 24 students. If all 9th graders are in the A group, then all 24 of them need to be in the classroom, as opposed to 12 on the A day and 12 on the B day.
Yeah, but that's why you're dividing it by half, right? You're saying not 12 of those 9th graders are in the A group and 12 are in the B group. So you're doing half and half. But I understand the point. Like, there's a lot of ideas. So that's why I asked about Chatham, and I think it's time to listen to all ideas. I understand the point about honing in, but this, I guess the idea here and between the Curriculum Council and the BT Connect was, all hands on deck in terms of ideas. But just one thing with Nick, while I don't want to belabor it, but maybe we want to, or if there is an update that you can give on before care, after care, because that was in Sean's presentation about a staff concern. I'm sure that's top of mind for a lot of parents that are planning to send their kids to school. Can we provide an update, or is that still kind of TBD based on the schedules?
Yeah, I think it's related to schedules. It's also a policy decision relative to facility use and the number of additional comings and goings of humanity in buildings. To what extent are we going to support the use of school facilities for non-instructional purposes? Having more classroom use, more gatherings, more people coming and going in buildings, I think that's a policy decision, right? It comes down to facility use. How are we going to approach facility use outside of instructional facility use? Whether it's co-curriculars, clubs, extracurriculars, community use, the Berners Township Recreation Department programs, other facility use, private rentals. We have groups that use the school on the weekend for church activities, things of that nature. All that stuff has been put on pause. Do we bring all of that back simultaneously with bringing students back? So there's a policy decision there, and how does the before and after care program fit into that policy making matrix? Assuming that the board says, yeah, I think that's going to be fine, let's continue to try to provide that service. Well, then obviously the question becomes, do we have the staff willing to keep running it? And do we need to make any changes to that program where staff is an issue, right? So like right now, what are the groupings of students? How many students are there? How many staff are there? Are we spacing those students out? How much space is being used? Normally the students might be, for example, in a multi-purpose room or a cafeteria. Now they might have to go to 8 different classrooms break up the space, break up the groups, spread them out like we are doing during the school day. You know, what are the implications for staffing if you do that? What are the implications for cleaning if you do that? So, you know, there's a policy decision to be made there. Do we want to try to keep providing that service? Assuming that the answer is yes, then we have to post for the staff, right? We have to post. So Sean writes a posting. Do we have staff? Do we have directors that want to direct? Do we have staff on the line that want to work with the students? Are they available or not? So those are questions. We have to sort through all that. You know, so you know, if the board wants to weigh in on that issue and give us some direction, you know, it is a question. How much facility use outside of instructional programming are we going to pursue and bring back all in September, right? A lot of student groups, clubs and co-curriculars coming together for things. Are we going to try to run all that stuff and social distance it when you have large groups of students and one advisor potentially working together? Are we going to run before and after care with, you know, potentially 70 to 100 students that would normally come together in a cafeteria? Now they have to be separated out into classrooms and we need staff. What does that do to the pricing of the program if you have to have more staff to break up the student groups and still have adequate supervision?
Anyone else? Mrs. Korn.
Hi, I know it's late, I'm sorry, but I just want to thank everyone. It was, you know, a really great presentation. The doctors were great. We're focusing a lot on the health, which is perfect, but then I was thinking about the mental health, which I know Stephanie, we have a great mental health program, but like I was looking at this article in the Washington Post by guys from Stanford regarding how like being safe and feeling safe are two different things, and schools have become kind of scary places. Just starting with all like the, you know, the school violence, and then now we have like, so kids are going to school thinking, wait, am I gonna get shot at school? And now they're gonna go to school thinking, am I gonna get a disease at school? Which is something we have to kind of mitigate because it's our jobs, right? Because their example is in 2019, it was 200 times more likely that a student would take their own life than have been lost in an incident of school violence. And we don't want to get carried away with making kids think they're gonna get sick at school. I mean, I know there has to be a balance there, and I know I'm sure we'll have a plan for it, because this is more the like introduction to how to get back to school. But I think it's really important to think about, especially with the little kids like Tim's talking about, like these kids are just little kids, you know, and wearing a mask, well, it's scary. It's a scary, scary thing for them. So isn't there ways we can mitigate that too? Like open the windows, use outdoor space so they can take the mask off, so they have some more normal times at school without feeling like school is, like, you know, like parents, you know, are keeping their kids home. It's like school's almost becoming like I don't want to say the enemy, it's the wrong word. It's just scary. So how do we make it the less scary? How do we do that while keeping them safe? I don't know the answer, but it's something to think about and to keep it top of mind, because you know, then it loses something, and school loses something. They lose their innocence really fast, and they're just little kids. And even the high school kids, they have a lot to deal with, you know, or the middle schoolers without this on top of it. So, you know, I just wanted to put that out there that, you know, we have to really think about that too when we're thinking about going back. And I appreciate the doctors so much, but, you know, there's other things to think about as well, you know. So.
Yeah, and you know, speaking to that issue, Jen, relative to masks and so on, you know, what I was trying to communicate is what I think is appropriate to start, and have a safe start and see what happens, see how many kids are in a room, how tight and close are the quarters, and then start looking for opportunities where maybe there is safe ways to take breaks and things like that. But I think we need a clear starting point for everybody to begin with.
Yeah, I was just thinking about like some of the more progressive ways, like more recesses for the young kids, especially when they're first back in school, trying to like ease them in a little bit or stuff like that.
Well, and that was one of the questions that came up in some of the comments that Ms. Fox read, right? Well, what about recess? Isn't there a recess requirement? So again, you go to the law, and what does the law say about recess requirements, right? And so that's what I mean when I say all of these little policy things that you have to work through. You know, you're trying to respond to a pandemic and bring kids back to school, and simultaneously you have all the laws that were in place that have no conception of accommodating a pandemic. So you get this, you know.
No offense, but I'm not looking forward to the policy meeting on Monday, FYI.
Hey, listen, I don't blame you one bit.
Anybody else? I don't see any hands. Am I missing anyone? Okay, well, seeing no further board forum comments, would someone like to make a motion for adjournment? Mrs. Beckman and Mrs. Wooldridge. All in favor? Thanks to everybody who tuned in tonight. And thank you to all our panelists. I know some are gone. We really appreciate it. Have a good night, everybody.
Good night.